Hear me okay?
Sure can. Thank you.
Thank you.
Doug Press, this is Joe Simidian. Could you call me on my cell phone so I could take care of a quick piece of business before the meeting starts?
Sorry, unmuting always helps. Would you mind emailing me your cell phone again? Super.
Yes.
Yeah, thank you.
We're now broadcasting live over the internet. Thank you.
Good afternoon, Doug.
Good afternoon.
We can see you and hear you. Thank you.
Thank you.
Good afternoon, Michael. And
Good afternoon.
Loud and clear, Michael. Thank you. And good afternoon, Dr. Day.
Good afternoon. How are you?
I'm well, thank you. You're all set.
Perfect. Thank you.
Hello, Laura.
Hello, can you hear me?
Yes, and we can see you as well.
Great, thank you.
And Nicole.
Hi, good afternoon.
Good afternoon. Loud and clear. Thank you.
Recording in progress.
All right, good afternoon, ladies and gentlemen. This is County Supervisor Joe Simidian, and as regular attendees will know, I have the privilege of chairing the Health and Hospital Committee. We are set for a 2 o'clock meeting. Let me turn to our clerk and ask if the clerk will call the roll and see if we have a quorum.
Vice Chairperson Lee. I saw him earlier. Vice Chairperson Lee, are you there?
Simidian here.
Smidian is here. We don't have a quorum yet, but I did see Supervisor Lee in the room earlier. He is attending the meeting currently. He just does not have his microphone or camera turned on at the moment.
All right, well, I was having a brief bit of technical difficulty, thinking I had taken care of all those issues before we started, and incorrectly so, apparently. So why don't we...
There, I see he is now here. Vice
right.
Chairperson Lee, is your microphone active?
Hey, can you hear me now?
I can hear you. We now have a quorum. Thank you very much.
Thank you.
All right, thank you to the clerk. Thank you to Supervisor Lee. And we now have established the presence of a quorum. That takes us to item number 2 in the meeting, which is public comment. And that, of course, is the period on our agenda where we set aside time for comment by members of the public on non-agendized items, things that are not on our agenda, but that are properly within the jurisdiction of this committee, the Health and Hospital Committee. So let's see if we have any speakers who would like to talk to our committee on things that are not on the agenda, but that are properly within the committee's jurisdiction. Let me turn to the clerk
Yes,
and
we
ask,
do.
how many?
We currently have 2 requests to speak right now.
All right, well, let's go ahead and allow those 2 folks 3 minutes, but we will ask that anyone else who wants to sign up, if they are out there on public comment, get their hand raised before the first speaker concludes their remarks, so we know that we have a limited and manageable number of folks given the 3-minute time. Go right ahead, Mr. Clerk, and let's go with our first speaker. Thank you.
The next speaker is Karen. I am unmuting you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking. And go ahead, Karen.
Yes. My name is Karen Del Campare. There is no legal basis for a mask mandate. The mask mandate is color of law.
Excuse me, Ms. Del Campari, let me ask the clerk to stop your time.
Okay.
This is time typically when we allow folks to speak on items not on our agenda, and COVID-related matters are on our agenda under item number 6. Can I ask you to hang on and speak at that time, please?
Okay.
And you'll have 2 minutes at that time, unless we have so many speakers that we have to cut the time a little bit in order to squeeze it in. But thank you for your patience, and we will get to these issues on item number 6. Let me go to the clerk and see if we have a second speaker.
Yes, we do. The next speaker is Carrie. I am unmuting you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Hi, I also have a comment related to COVID, so I will wait as well.
Thank you so much. And folks, I know many of you are new to these committee hearings and trying to follow our process, and I appreciate your patience and your forbearance here. Let me check with the clerk, see if we have anybody else under public comment. And again, that would be on items not on our agenda.
No, we do not have any requests to speak.
All
Thank
right, then without objection, Supervisor Lee, I will indicate that we have completed public comment. Thanks again to our speakers for hanging on just a few moments. That takes us to item number 3, which is to approve our consent calendar and any changes to the committee agenda. The one thing I would highlight, not a change, but is we do have the tobacco and vaping enforcement item number 11 scheduled as a time certain item, meaning we will take it up at 4 p.m. or as close to 4 p.m. as we can possibly manage. With that understanding, Supervisor Lee, would you like to offer a motion to approve the consent calendar and the published agenda? Or
Yes, so moved.
All right. Motion by Lee, second by Simidian. Let me check with the clerk to make sure there are no speakers on the consent calendar.
We do have one request to speak.
Okay. Let's go right ahead and allow that person 2 minutes, please.
All right. The next speaker is Kai. Our next speaker was Kai. Kai lowered up. No, Kai's back. Okay, Kai, I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer
All
will
right,
start
and
when you begin
again,
speaking.
Speaker, if this is for COVID-related items, that would be item 6 rather than consent calendar. But if it's, excuse me, rather than consent calendar, but if it's a consent calendar item, go right ahead. Welcome.
Kai, go ahead.
Can you guys hear me? Sorry about that. Thankful to be in this meeting with you guys. Hopefully, productive things get processed through. I just was wondering, like, how come I can't see like how many people are on this meeting?
I can tell you that we have roughly 60 participants, and I just happen to know that. But let me ask the clerk, and ordinarily we don't go back and forth, but let me just ask the clerk, do members of the general public have the ability to assess how many folks are in the meeting at any one time?
No, I don't believe they do.
All right. More than that, Kai, I do not know. So go ahead.
I'm wondering the rationale behind that, please.
All right. Well, I think I'm going to ask the clerk to follow up on your inquiry, but we don't go back and forth on these kinds of matters. This is an opportunity for you to comment if you'd like to comment. And again, on consent calendar items, which so far have not been raised. So go right ahead if you'd like, but I'm going to have to cut you off after your next remark if it doesn't address a consent calendar item.
I think it's kind of related, but okay, it's up to you.
All right, then we'll say thank you. And is it Mr. Kutch who's clerking for us today?
That's me, yes.
All right, then why don't we ask, I don't think there's, I'm not aware, I should say, of any formal decision by anybody about publishing or publicizing the number of folks who are participating. I don't know if it's just a function of the Zoom system we're all using, but let me just ask you to find that out for us, and I'm happy to share that information the next time we have a Health and Hospital Committee meeting, if it's a matter of interest to the public. Okay,
Sure.
Mr.
It's
Kutch?
currently a technical limitation, but we'll work to see if we're able to change that. But right now, it's just not a feature that's an option for us.
Yep, that was my understanding as well. And as I say, it's, just like you could, if we were back in chambers, look around the room and say, oh, there are about 60 folks here. It's certainly not anything that's confidential by any stretch of the imagination, in my understanding. All right, that finally takes us to item number 4. Well, let me ask for a roll call vote on the consent calendar, since we do have a formal motion and we'll want to approve that.
Vice Chairperson Lee.
Aye.
And Chairperson Smidian.
Aye, thank you very much.
you.
That takes us to item number 4, which is to approve appointments and various reappointments of specified enterprise medical staff and allied health professionals in our hospital system. This item is contained in our published agenda. We usually hear from Dr. Kranis on this item. Is the doctor with us today?
Yes, I am. Good afternoon. I'm here to present.
Thanks so much, Dr. Kranis. I'm going to ask if we have a motion to approve from Supervisor Otto Lee.
Yes, so moved.
I will second. I will then ask Dr. Kranis if you have any comments you want to make, or if you would just be happy to take yes for an answer, if we can get there in a minute.
I'm happy to take yes for an answer.
All right.
Thank you.
Supervisor Lee, any questions? Don't want to preclude you from weighing in. Nope. All right. Looks like things are pretty much as anticipated this week. Why don't we ask the clerk if there are any members of the public who want to speak on item number 4?
There are currently no requests to speak.
Then let's please call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Smidian.
Aye. Thank you very much, Dr. Kranis. Thank you for being with us. Appreciate your willingness to take a break in the middle of the day here. Go back to motion passes for the record. That then takes us to item number 5, which is to receive the report from the folks at Facilities and Fleet, the department, on as well as the Valley Medical Center folks and the county executive relating to our child and adolescent psychiatric facility, the Behavioral Health Services Center at VMC. Is there someone from Facilities and Fleet who'd like to tee this up? I know we also have Ms. Soloff from the Harvey Rose organization and some other consultants who are going to help us keep track of our schedule a little bit. But let's start with Facilities and Fleet. Mr. Koenig, did you draw the straw today?
Yes, I did. Good afternoon, Supervisor Smitty and Supervisor Lee. I have nothing to add to the report, but am prepared to answer any questions.
All right. Supervisor Lee, I do have a couple of questions. And I just want to make sure that I'm understanding what the staff report is providing. Mr. Koenig, my reading of this, well, in one place it says, I'm looking at page 2 of the 4-page report, packet page 17, for those who are working from a packet page. It says that you'll continue to monitor design progress by HGA. The 100% design package is expected to be submitted to the Department of Health Access and Information, formerly OSHPD, by mid-February 2022. And I know that you prepare these reports ahead of our meetings. So it occurs to me that today is, in fact, after mid-February 2022. Did it get submitted on the timely basis that you were hoping and anticipating?
There's still one increment that they're trying to get in. They believe it'll be in by next week.
Okay. And does that mean that they had to hold off on turning more or less the whole thing in while they waited for that one increment? Go right ahead.
Yes, it means that we will not get the 100% construction document package until that's submitted.
Okay. Could we get an off-agenda report to Supervisor Lee and myself, and you might as well get it to the whole board, the day that the full report has been submitted, so that we know that it has been done. And I'm going to work on the theory that until I get that notice from you, it hasn't been submitted. Okay.
Okay.
And then it goes on to say, once submitted, the administration plans to prepare a recommendation for the board to adopt plans and specifications and authorize the advertisement to construct the new APBHSC. This will most likely occur in March of 2022. When you use the phrase authorize the advertisement to construct, I take that to mean what I would colloquially refer to as put the project out to bid. Am I understanding that correctly?
That's correct.
Okay. And you need our board to authorize that because we will now be using a new contractor and we will have a specific set of specifications that we are bidding on. Yes?
That's correct. This will be the first time we'll have the complete construction document package.
Got it. And what's your current thinking about timing, given the fact that there's apparently been a little bit of a delay in submitting the full set of plans to the folks at Healthcare Access and Information?
I think if we get them by the end of next week, we would try to get that to the board in March.
All right. All right. Well, we will keep our eyes open then for notice. And let me go to Ms. Soloff from the Harvey Rose Organization, see if she has anything she wants to share. Those of you who have been following this item will recall that we had asked at the board level to have some oversight on the construction timeline to make sure that we were fully and accurately apprised as the project moves forward. Ms. Soloff, welcome. Anything you want to share with us today?
Yes, thank you, Supervisor. We have, as you know, the board had directed us to obtain the expertise that we would need to provide you with independent review and of the schedule and progress of the child and adolescent inpatient facility. And so I wanted to introduce you today to folks from Veneer Construction, which includes Raphael Martin and Anthony Foster Davis. Mr. Martin is Director of Technical Services for Veneer, and Mr. Davis is Scheduling Manager for Veneer. And they're both here if you wanted to, you had any questions for them regarding, you know, our plans to review the progress and the schedule or their expertise.
No, thank you. I will say welcome to Mr. Martin, welcome to Mr. Foster Davis. Nice to see you both. Thank you, Ms. Soloff, for following up so quickly and thoroughly on the direction from our full board. I know that was a wide-ranging conversation, so I should just let you know, Mr. Press, I think from our county counsel's office is on the call, and Mr. Press, I'm working on the understanding that we can go forward as we typically do with our Harvey Rose folks subcontracting, so we can make all this happen sooner rather than later, since that's the goal of the exercise. Yes?
Yes, Chairperson Smitty, and I'm not aware of any prohibition on their subcontracting.
Great. Okay. I'm sure that's a relief to the folks at Veneer who are sitting here in the meeting. So good to hear. And Ms. Soloff, that means that we should do three things, and that's go, go, go. Okay. So let's please do that. Again, gentlemen, thank you. Welcome. As I'm sure you've heard from Ms. Soloff, the goal here is to make sure that as we're assessing the timeline going forward, that as the work gets done thoroughly and professionally, that it gets done on a timely basis as well, and that the estimates that we are provided at the committee and the full board level are in fact accurate or practicable in terms of performance. We just want to make sure we know what the timeline is and that we don't let anything get in the way of a clear understanding there. So thank you again. Thank you, Ms. Soloff. I hope we're all squared away. I'm sure we'll have questions for you once you dig in, gentlemen, but not today. And let me say thank you to Mr. Lee. Supervisor, any comments or questions on your behalf before I ask the clerk if there are any comments from the public?
Yes, we do have a question regarding some of the estimates that's been coming in. The original estimate was around 370. Now we're talking about 406 and 501. So I just want to see if you could explain a little bit on these increases. I mean, obviously, I'm sure inflation has a lot to do with it, but trying to see if we could maybe a more accurate number. Again, I mean, if we're going to get it rebid again, it all depends on what the final number is. But just want to share and anything that you can have regarding these cost estimates, very helpful, because that's substantially more than what we started with.
Mr. Koenig?
Yes, the spread is due to the two data points that we had. We had the original estimate, which was reviewed by our consultants, prepared by Excel, and that was back in March of last year, and that was the 370 to 385 million. Since Excel notified us in June that they could not meet our date, they had essentially been increasing the estimate almost on a weekly basis until November, and that was the last number they provided. That was the 496 million. At that time, we had our consultants, our cost consultants, Cummings Group, reevaluate their estimate and look at the differences between that and what Excel prepared at the $496 million range. And they did not come to agreement, and Cummings Group held that the estimate, in their opinion, was closer to the 440 million. So we, looking at Excel's motivation to control that cost or that estimate, we were always a little bit concerned because as that estimate grew, it supported larger fees for Excel, and that's why we didn't have a whole lot of confidence in that number, and that's why we believe that Cummings was probably closer. But again, like Supervisor Lee said, we won't know until we get the final bids in what the actual number is going to be.
Thank you. Supervisor Lee, additional comments or questions?
Oh, that's all I have. Thank you very much.
All right, then let me just turn to the clerk, see if we have anyone queued up to speak on this item.
There are no requests to speak.
Then if we could simply get a motion, Supervisor Lee, to receive the report. Again, we'll thank the folks from Veneer. We'll thank the management audit team, of course, the folks at Facilities and Fleet, but motion to approve receipt of the report would be timely.
All right, so moved then.
Thank you, Supervisor Lee. We have the motion to receive. I will second. Let's call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye.
Thank you.
Thank you very much. That takes us to item number 6. And this is the item that we have on COVID-19 report today. And we did have some folks who are queued up to speak on that item. So let me just ask, if you want to speak on item number 6, which is the item we're about to take up, where we will receive the report from the public health officer relating to vaccines and COVID-19. This is the right time. I'm going to ask you to raise your hands right away so that we know how many folks we have, because that's the only way we can manage our time fairly and effectively. I am told, and I may be surprised, but I'm told there is no PowerPoint today. We'll have an oral presentation, but let's hear from members of the public first. Mr. Kutch or whoever is here with us from the clerk. How many folks do we have raising their hands?
We currently have 8 requests to speak.
All right. Why don't we give folks just, I'm going to say another 30 seconds. If you'd like to speak on this item, please raise your hand now so we know how many folks we have, because that's going to determine how much time we can allocate. So we're just going to let the clock tick away here for another moment or two while we ask the folks at Public Health to get themselves ready for the presentation on item number 6. And Mr. Kutch, what are we looking at this point?
We currently have 9 requests to speak.
All right, let's, Supervisor Lee, if you're amenable, I'm going to sort of split the difference given the number of folks we've got and ask the clerk to set their timer for 90 seconds, minute and a half. I now see we've got 10 participants raising their hands. So by the time we have gotten through that first speaker, who will have a minute and a half, we will cut off the opportunity for new speakers to line up in the queue. But again, you'll have that first 90 seconds. And I know we've got 10 folks who've raised their hand already. Mr. Kutch, are we ready to go with 90 seconds?
Yes, we are.
All right, then let's go right ahead and take the speakers in the order that they are queued up. And thank you again to everyone who hung on from earlier in the agenda. Appreciate your effort to work in our agenda format. Go right ahead.
The next speaker is Noreen Mooney. I'm unmuting you. Please accept the unmute. You will have 90 seconds to speak. The timer will start when you begin speaking.
Yes, I am speaking in regards to the COVID-19. Sarah Cody is not a traditional doctor in a sense. She has never seen a COVID patient in her life. All we get from Sarah is her opinion, not scientific facts. As to date, she has not produced any statistical evidence or studies that show her policies have worked. Even the CDC contradicts her guidelines in Santa Clara County when it comes to masks. The mask efficacy, I have a research study by Jeffrey D. Smith, effectiveness of N95 respirators versus surgical masks in protecting public health care workers from acute respiratory infections, a systematic meta-analysis, CMAG, May 17, 2016. Using less than N95 respirator doesn't reduce viral infection rates is a summation of this. Another I have, Dr. Fauci stated in a USA Today article, a mask is much more appropriate for someone who is infected and you're trying to prevent them from infecting others than it is protecting you against infection. If you look at the masks that you buy in the store, leakage around doesn't really do much to protect you. In the US, there is absolutely no reason whatsoever to wear a mask. The other thing is CDC admitted that cloth masks have never been effective. The public wants again to see. There's another NIH study is that masks is.
All right, thank you, speaker. And let's go to the next speaker, Mr. Clerk.
The next speaker is Sylvia. I'm unmuting you. Please accept the unmute. You'll have 90 seconds to speak. The timer will start when you begin speaking.
Hi, can you hear me?
Yes, go ahead.
Yes, I'm sad that it's only a minute and a half. I think I should have spoke at the beginning, which was 3 minutes. But my point is I've heard previous Santa Clara County meetings, a lot of firefighters speaking, they're losing their jobs because they cannot get the booster. And I'm worried that that's putting our communities in danger during fire season. Many of these fighters have been working for over 10 years. They have experience. And I know that the new recruits have been cut short in their training. So I think this is a serious, serious, grave thing for you all to investigate. I also would love to see all of our paid employees, yourselves, supervisors, county directors, to appear in person. The life for normal people, such as those who are speaking, is not on Zoom anymore. We're in person. Our children are in school in person. So we all feel that you're hiding behind the Zoom. We'd like to see you all face to face at those buildings we pay for. They're huge. They have amazing views. and we don't enjoy this Zoom anymore. Also, I'm worried about the police department getting fired because they aren't getting their boosters because of myocarditis risk, which is a real risk. Their crime is so prevalent in our communities. Please investigate. These people should not be fired because they don't want to get a booster. That's just ridiculous. So we appreciate your attention to these urgent matters. We're scared of fire season for sure.
The next speaker is Karen. I'm unmuting you. Please accept the unmute. You will have 90 seconds to speak. The timer will start when you begin speaking.
Yes, hello, my name is Karen Delcampara. There's no legal basis for a mask mandate. The mask so-called mandate is color of law and must end immediately. Cases are below 550 per day and have been declining rapidly. We do not need to wait for a 7-day rolling average. Masks are also not effective to prevent COVID, especially when worn by children. And N95 masks have never been approved for use in children. Children are being harmed by masks. They suffer delayed speech, lowered IQ, acne, panic, anxiety disorder, depression, respiratory difficulties. These are just a few of the problems of masking children. California Department of Health will likely remove the mask mandate for schools on the 28th of this month, and Santa Clara County must allow children to breathe. There should be no vaccine limitations on the unmasking of children. The vaccine does not reduce transmission. There's a lack of safety data. And in the trials for children, there was proven fraud. Maddie DeGaray, who was paralyzed by the Pfizer vaccine, was written up as just having abdominal pain. There have been 4 cases of children in Monte Vista Christian School having myocarditis. This needs to be investigated. That's an average of 1 in 50 children with myocarditis.
The next speaker is Carrie Bobson. I'm unmuting you. Please accept the unmute. You will have 90 seconds to speak. The timer will start when you begin speaking.
Hello, thank you for your time today. It's interesting to me that we only get a minute and a half as well. And I also just need to make a comment about the fact that I understand you're having technical difficulties in expanding a visual Zoom meeting to 60 people. And we've been in Zoom for years now, and I can tell you it's not difficult, especially considering we're in the technical mecca of the country. I mean, I find that disgraceful, quite frankly. Also, I'd like to know, I mean, we want to see you. We can't see you in person. We'd like to see you in Zoom. I don't see Sarah Cody on this call. Again, we would like to see our representatives that we pay to be in office here. So many things have been said about the mask. I agree with. We need to unmask these children. And I think it's important to look at what other counties are doing around us, and with success. It's the rates of infection and transmission are not higher than ours. And so why are we not looking at what's working for other counties that's less restrictive to our community and our society? It needs to be looked at. I agree with Silvana about the police and the fire department, getting rid of the veteran people for new people it's a recipe for disaster.
Our next speaker is Uvish Kumar Mehta. I'm unmuting you. Please accept the unmute. You'll have 90 seconds to speak. The timer will start when you begin speaking.
Washington Board of Supervisors, Chairperson, Vice Chairperson, again, for the opportunity to speak. As a part of a COVID-19, it has already been taken, 2 to 3 years, coming out from a pandemic and going towards pandemic. However, in order to go towards pandemic, what is required to be ensured is that, we close the digital divide. We request that, every children, they are being provided the right set of nutrition and services, that would allow them to have the vaccination with the affordable rate. Also to ensure that under the COVID-19 guideline, those children be protected with the mental health as well as from the exploitation, abuse, that is taking place. Also to ensure that increasing the access to a clean water, hygiene, and environmental avoiding the environmental degradation and the climate change for those children. Also to make sure that having them providing the adaptation strategy within the school, as well as making sure about that, they are able to they are able to receive the right set of nutrition within the school program as well. These are the considerations to make under the COVID-19 plan before opening up the schools, as well as making sure about that the children under the 5 age also getting the right set of vaccination. There is a holistic plan to approach to it. There is a lot more things to be taken care of, under the COVID-19.
The next speaker is Kai Y. I'm unmuting you. Please accept the unmute. You will have 90 seconds to speak. The timer will start when you begin speaking.
Hi, yeah, like I said, I'm thankful to, actually be able to voice my my concern, I know that for you guys making the decisions for us, like it's all new, we've never had this before, but like the death rate according to your website or the people that made the website is 2,102 deaths, right? Out of a population of 1.9 million people in the Santa Clara area. That's not even 1%, that's 0.001%. And for that to be considered an emergency, and then for the people that, however which way they're making the decisions, it's like, why don't you guys just let us decide? It's not an emergency anymore.
Next speaker is Amy V. I'm unmuting you. Please accept the unmute. You will have 90 seconds to speak. The timer will start when you begin speaking.
Yes, hello, Amy Barton. My son is at Santa Clara University and I work at a Santa Clara company. Omicron has been spreading. It's actually already done. It's way on the downturn. And we saw with Omicron that it spread between masked and unmasked and vaccinated, boosted, or unvaccinated. So it didn't stop the transmission, and all those breakthrough cases were vaccine failures. We really hope these vaccines were going to be the thing that was going to take us out of it. They have not. They have been failing, and we are seeing more and more and more and more safety data that is coming out from the Department of Defense. We've seen a 1,000% increase in neurological disorders that have happened to our military. This is frightening, and it must absolutely be looked at before we are mandating this vaccine to more people, especially our police, especially our firefighters, especially our students and our next generation. This is absolutely outrageous that we continue to have these masking rules. We're seeing that masks are not stopping transmission, that vaccines are not stopping transmission. We saw in Los Angeles, that Los Angeles declared 95% mask usage in December. That was right before the huge spike. So these are not working, and these permit rules, any of these rules have no place in California and no place in a constitutional democracy. They create a place where neighbors are reporting on neighbors for not wearing masks, and all of our actions and personal movements will be tracked with any kind of vaccine passport. The government can dictate what goes on your face, what goes in your body, and where you can and cannot work.
The next speaker is Karen OE. I am unmuting you. Please accept the unmute. You'll have 90 seconds to speak. The timer will start when you begin speaking. And Karen, are you there?
Can you hear me?
Yeah, go right ahead.
Okay, hi. I actually personally sent Dr. Cody a email with a link to the Senate hearing that Ron Johnson held with all of the top doctors in the United States and some out from other countries, with all of the information that she or anyone else would need to know to make a decision. I also sent it to the virology department. There is absolutely no data that says that these shots that are gene modifying therapies, they're not vaccines. You can go to the website and it says it there, are stopping the spread of any of this. Has anybody been to the VAERS website? That's the Vaccine Adverse Event Reporting System. It's an actual CDC website that shows all of the injuries and the deaths and all of the data regarding the vaccines shots. Also, there's no data that provides anything to say that masking works. It doesn't stop transmission. The children generally don't get this virus. They certainly don't transmit it. the damage that's being done to everybody with breathing their own bacteria and covering their faces is absolutely absurd. Like I said, I sent that video out with all of the information anyone would possibly need to Senate hearing.
The next speaker is Mike Rogers. I am unmuting you. Please accept the unmute. You'll have 90 seconds to speak. The timer will start when you begin speaking.
Hi, my name is Mike Rogers. I wanted to identify myself as a member of the Santa Clara County Health Advisory Commission, but additionally state my comments here are my own and don't reflect the broader commission. A year ago, we saw preliminary data on these vaccines that showed they had very high efficacy against infection, as high as 85 or 95% protection against infection. But today we know they have very poor durability in that respect, especially against the variants of Delta and Omicron in the summer and winter seasonal surges. Today, we have 140 published studies on the efficacy of previous infections and being far superior to the vaccines and preventing infection and transmission. Some of the most recent ones, including very clear studies on Delta from CDC and California's data, and from countries in Europe and the Middle East showing efficacy against Omicron. Omicron does affect people who have been previously infected, but our county's policies and descriptions by the health department don't describe natural immunity. The vast majority of our citizens have had COVID. It is a gross injustice that people that have superior immunity are being fired. The vast majority of them had COVID. We're heroes and firefighters and nurses, and we have staffing shortages in many parts of the county in these areas. It has to be a negative health outcome as a result of these staffing issues. It's a gross injustice at some levels that we aren't changing what we're doing in regards to this. Thank
you.
Mr. Kutch, before we go to our next speaker, could I just ask where we stand in terms of folks in the queue? We had 10, and I asked that we cut the queue at after the first 90 seconds. Where do we stand? I'm concerned about managing the rest of the agenda. I do want to let everyone who wants to talk have a chance to talk. I need a little help managing the queue here.
We currently have 6 requests to speak, and we've had 9 speakers speak already.
All right, well, these 6 will be our last. And if there are folks at the very end of the meeting, we can revisit it at that time. But I do feel an obligation to get to the rest of these items. So let's go ahead and hear from those 6. And then if there's anyone left at the end of the meeting, we'll be happy to hear from them at that time. Go right ahead.
Sure, I'll announce them. We have Lydia, Terry Satterwhite, Megan Malhot, Carol Brule, Dalila Polito, and Jason Kim. So those are the 6. I'll start with Lydia.
Thank
Lydia,
you.
I'm unmuting you. Please accept the unmute. You will have 90 seconds to speak. The timer will start when you begin speaking.
Hi, can you hear me?
Yes, go right ahead.
Hi there. So I've been on a couple of calls. I worked in frontline. I'm a nurse, an RN. I worked at Valley Medical. They let me go November 1st after not accepting a religious accommodation, though I've had many in the past. I think it's a crime. I think our cries are falling on deaf ears. I think it's a shame that our board and our health officer
Recording in progress.
is not listening to their constituents. And it's hard now for you to hide behind.
It's hard now for you to hide behind.
Can I speak?
Lydia, are you still there? I think we had a technical issue.
Yes, I'm here.
Go right ahead. Sorry about that.
That's okay. I'm very, very discouraged at this point because I feel as though our cries are falling on deaf ears. And I know I'm not alone in my discouragement. I know that the Lord above is watching everything that is happening and the injustice, and that the powers that be, their emergencies do not last 2 years. This right there is a telltale sign there's something very wrong, but that's okay because God is the judge. And there's a story in the Bible about Haman. Haman made gallows and he did it against the people, but it turned around on his head. So I wouldn't mess with God's people.
The next speaker is Terry Satter-White. I'm unmuting you. Please accept the unmute. You will have 90 seconds to speak. The timer will start when you begin speaking.
Hi, can you hear me all right?
Yes, go right ahead.
Thank you. Yes, I just wanted to ask, or at least state about the last call with Sarah Cody, who in the past and recently provided the bars and the graphs regarding the cases in Santa Clara County. And there really wasn't a drill down. And if someone could provide that information, I don't believe it's correct. I'm also concerned about the VAERS report, and nobody seems to really acknowledge that. It's over 1 million reports on VAERS, and many people already know it's very difficult and time consuming just to report something through VAERS. And the current report is dated up to February 11th with the highest amount of reports, 33,590 myocarditis and pericarditis, following 43,476 permanently disabled, and then a whole other breakdowns, but the deaths is 23,990. Regarding Santa Clara County, I know they had a talk with NAMI recently explaining how families with kids could recognize mental health with kids. Unfortunately, I think they're a little late with this information. A lot of parents are already at a much advanced part with dealing with suicidal kids. I believe that fixing the root of the problem really needs to start and recognize these mandates are killing our kids.
The next speaker is Megan Malhot. I am unmuting you. Please accept the unmute. You'll have 90 seconds to speak. The timer will start when you begin speaking.
Yes, hello. I agree with the last lady who spoke about the VAERS process that is incredibly difficult for doctors, nurses to report adverse reactions and deaths. The numbers are beyond the reports on VAERS. There's been a group of, there was an industrial hygienist group that wrote 27-page letter to the CDC, the NIH, and other government officials recommending N95 type mask is inappropriate for general population and children. CDC has issued harmful guidance for masking children that contradict manufacturers' recommendations, worldwide standard practice in CDC's own guidance, and without appropriate risk. The CDC's position for mask use by the general public lacks proper scientific justification and creates potential harmful base based on a false sense of security. Why would we trust the CDC, the FDA, when they have continuously been called out for improper data and a multitude of false claims?
The next speaker is Carol Brouillet. I am unmuting you. Please accept the unmute. You'll have 90 seconds to speak. The timer will start when you begin speaking.
I appreciate what the previous speakers spoke about, and I am very strongly opposed to masks because I think, as the previous speaker said, that there's no justification for them scientifically. I think they're part of a giant psychological warfare operation directed against the American people and the world right now. In fact, this whole event is really an attack upon humanity, a criminal conspiracy, and it's been laid out. I'll send you the links. There's a grand jury proceedings that's taking place over several days with international lawyers around the world. Dr. David Martin has spoken extensively about this in the documentary Indoctrination and pointed out that the vaccine themselves are not vaccines, they are gene therapies, and they really are a bioweapon. I think the most disturbing data is that we see from the insurance companies, which show the rise in mortality rates. So what these vaccines or gene therapies are doing are shortening the lives of many people, those that they don't kill right off the bat. And this is very concerning. I'm going to send you all the information. You could either be with the people and stand up to this attack upon humanity, or you could be part of the fraud that is being committed. Pfizer has been committing fraud. All their data is corrupt, and you've been aiding.
The next speaker is Dalila Pulido. I am unmuting you. Please accept the unmute. You will have 90 seconds to speak. The timer will start when you begin speaking.
I recently saw a sign that speaks truth. It said, wearing a mask and getting the vaccine doesn't make you a good person. Getting COVID does not make you a bad person. Advocating for the suspension of others' rights or access to a job or health care does make you a bad person. Because of the propaganda being spread by you, the news, etc., we have to deal with people spewing hate towards the unvaccinated, saying things like, you will get COVID and kill your loved ones. Don't take up any hospital beds. We hope you die. Since when do we demonize someone for getting sick? People who never stopped working during the entire pandemic are now fired, and none of you speak up against this. How can you consent to this violation of human rights? I know so many unvaccinated, including myself and my 6-year-old son, who have gotten COVID. We all had mild symptoms. None of us ended up in the hospital. None of us died. Why should I be forced to get vaccinated and vaccinate my son due to your fear? My rights don't end because of your fear. Thank you.
Final speaker is Jason Kale M. I am unmuting you. Please accept the unmute. You'll have 90 seconds to speak. The timer will start when you begin speaking. And for future speakers on this item, the public comment period was closed after Jason Kale M. And that was the announcement we had from the supervisor earlier. I just wanted to reiterate that for if there were anybody else that was trying to speak on the item. Thank you very much. Jason, you have 90 seconds. Go right ahead.
Hi, the COVID vax mandate, the mask mandate, social distancing for 2+ years is evil. VAERS data says that there are significant dangers to the vax. I myself had an adverse reaction to the vax. There are treatments for COVID other than the vax. Fauci and friends such as Apple, Google, Amazon are busy protecting their bottom line. And also, many of you may not have known this, but there is a 2015 study that was published in Nature Medicine. And let me just sum it up in 25 seconds. Scientists in the United States collaborated with Chinese scientists in 2015 or earlier to weaponize the bad coronavirus. The gentleman named Ralph Barrick, who is a big name from UNC Chapel Hill, was the principal scientist, along with Zhangli Shi of Wuhan Institute of Virology. So given all this, I would recommend to the city managers there to please let the people be free. There are lies being told by the media that is destructive and evil. So please just let the people free. Thank you very much.
And that concludes our request for public comment.
All right. Thank you to the clerk. Thank you for those of you who took time to share your thoughts with our committee. For those of you who might still like to comment, who have not yet had a chance to speak, we will open up the opportunity to speak once again on this item after we have completed all other items on today's agenda. But I did want to make sure we had time for the rest of the agenda while still accommodating as many speakers as we possibly could. So we'll go to the Public Health Department now for their report, and then take comments and questions from the two members of our committee.
Good afternoon, Supervisor Simidian and Supervisor Lee. This is Dr. Sarah Cody, and I'll be making the report today. I don't have a slide set to go with this, but I will just note that what I'm referencing is all available on our public-facing dashboard. So in short, just to get to the top-level message, it's that all of our metrics are heading in a very positive direction. We're seeing very encouraging signs that this Omicron surge continues to abate, which is very, very good news. So for example, when we look at our wastewater surveillance, We see that we are continuing to see a decline in all 4 sewer sheds, as well as in our case surveillance. Our cases, as you know, and we've talked about before, many people are now antigen testing at home. So we're confident about the trends, although we know that the cases reported don't represent, of course, all of the cases that may be occurring in the community. Our positivity rates are down, as are our hospitalizations. And related, our vaccination metrics continue to improve. We have very high rates of vaccination. We continue to make progress, although now a bit more slowly than at other times. So I want to talk first about the mask mandate, because I know that's certainly top of mind for everyone. So I thought I would just dive right in. So recall that we had set metrics back in the fall of last year for when it would be appropriate to lift the mask mandate. And our metrics were around vaccination, hospitalization, and community transmission. The community transmission metric we did alter in the setting of Omicron because in general, people's illness from Omicron tends to be less severe. And so we felt that it was appropriate to modify that metric to the Omicron context. And we kept that metric in place. We kept the decision to follow the metrics as an indicator for when it would be appropriate to lift the requirement to mask. And that was for a number of reasons. One is that we wanted to keep our commitment to follow the metrics in making our decisions. And second, it's that the masking overall helps to decrease the community transmission, which is still important. And a couple of reasons for that. One is if you prevent infection, you're preventing long COVID, which is a condition that we will talk about and that we're still trying to understand the scope and magnitude of this. And also there are, of course, a number of people living in our community who remain vulnerable for whatever reason because of age or underlying medical condition or vaccination status, and they still need another layer of protection until the community transmission abates a bit. So I'm now going to just review where we are with each of these metrics. Our first metric was vaccination greater than 80% of the whole population. We now have 84.7% of the entire population of Santa Clara County is vaccinated, and we just surpassed 90% of eligible. So 90% of people age 5 and up in our county are vaccinated. We also are continuing to make headway on boosters. 68% of our booster eligible are boosted. So we have clearly met the vaccination metric. For hospitalizations, we were looking for hospitalizations low and stable. We have also met that metric. It's important to know that the hospitalizations during the time of Omicron have looked a little bit different than hospitalizations during other phases of the pandemic, in that a greater proportion of those in the hospital have been hospitalized with COVID rather than for COVID. So it still has an impact on the hospital because of isolation protocols, but not as much as if during the times when there are a higher percentage of people hospitalized for COVID. And the final metric, which is community transmission, what we're looking for is a 7-day moving average of 550 cases per day or less. And today, as you can see on the public-facing dashboard, our 7-day rolling average of new cases is 555. So we will be meeting that metric tomorrow. I think that looking ahead to where the data are coming in, our trends are very promising, and I anticipate that we will meet that metric tomorrow, and that we will continue to trend down. So that is where we are now. And of course, looking ahead in the pandemic, we still live with a lot of unknowns. So we're very encouraged that we're coming out of this Omicron surge. We are all looking forward to a time where we can, remove our masks and feel safe. And of course, we can't predict what might happen in the future as far as emergence of other variants. That in large part depends on forces around the world more than it does what we do here at home. But I think in closing, before I open it up with your questions, I would just continue to emphasize the enormous commitment of so many in our community that have helped to keep all of us safer during this unprecedented and very difficult time. Thanks.
Thank you, Dr. Cody. Let me turn first to my colleague, Supervisor Lee, and see what he has in the way of comments or questions. Supervisor Lee?
Yes, thank you, Chair, and thank you, Dr. Cody, for the good news that you're telling us that, there are three things, right? You said the vaccination rate we reached, the hospitalization rate being low and stable we've reached, and we are trying to meet the third criteria, which is a community transmission to below the 550 reported case per day, and that we have. So today you said 555, so we're getting really close to it. So once we get below that number, Dr. Cody, how many days does it have to go below that? Do you see you would potentially look at the changing on the mask mandate issue?
So the goal that we set is to hold at 550 or below for 7 consecutive days. And the way things are trending, I'm very confident that we will, the trend will continue at or below 550 a day.
Great. So once we got that, that would be the time when you might determine changing the mandate on the masking. Great. Now, this masking mandate has no effect to the issue regarding the issue of getting boosters, right?
That's correct. I want to clarify a few things. One is that once we meet our metrics, we'll transition from a mask requirement, but we will continue to have a recommendation to mask indoors. And that's because we still do have a significant community transmission, not as high as we've seen, but not low either. Second, I want to clarify that under the state's rules, masking is required in K through 12 schools. That's a state requirement, not a local requirement. And the state still requires masking in a number of different settings, including healthcare settings, public transportation, and other more vulnerable or crowded settings. So once we lift the mask requirement here in Santa Clara County and transition to recommendations, those state requirements will still be in place.
Right. So when you talk about a state requirement, you say public transportation, healthcare setting, or K through 12 schools. So basically any area that you have a lot of people, that would be the case. So the people are going out to the movie theater, go to grocery stores, those will still be applicable by the state mandate, correct?
No. So the state requirements don't include many public indoor settings. So the state requirements would not apply to movie theaters or gyms or grocery stores. Those would transition to recommended, but not required.
Okay, got it. Recommended. And certainly if people want to wear the mask, they absolutely have the right to wear the mask as long as they want to, right?
Of course, and again, this is a transition from a requirement to a recommendation, but it's still recommended. The Centers for Disease Control still continues to recommend masking in communities with substantial high transmission.
Right, great, thank you. Now, we see that there was during the peak of Omicron, let's say about a month ago, there are certainly a lot more lines of people trying to get the testing right. And looks like the testing numbers also going down as well in terms of the demand side. How are we doing on the progress on this ramping down of our staffing and the resource on the testing, in that case also even vaccination as well?
Right. So in many areas of our operation, including mass testing and mass vaccination, the demand is waning. And this is a pattern that we've seen with each surge. So our challenge across the county, not just with mass testing and mass vaccination, but also with outbreak investigations and many of the internal operations, is to understand how we can stand down a bit, but preserve our ability to surge when needed for the next peak, whatever that may look like.
Mm-hmm. Great, thank you. Yeah, so I would say certainly we are looking pretty good right now. Now, of course, there are also people talking about potentially also other new variants. Have you seen or heard about the other variants, and you might like to educate us what you've been hearing?
The variant that we're looking at most closely is a sublineage of the Omicron variant, the BA2. And in some parts of the world, it seems to have a growth advantage, or that is, it's overtaking the BA1, the Omicron variant that we're seeing most of. We do have cases of BA2 in our county. We're so far not seeing it's. We're looking for signs that our decline would begin to stall a little bit because of the emergence of BA2, and that's not what we're seeing so far, which is good news. So our cases are continuing to decline at a pretty brisk clip, and no other variants of concern on the horizon at the moment.
Okay, great. Yeah, so this morning I was listening to the radio, and somebody was trying to explain that masking is like wearing a raincoat. You know, when it rains a lot, then you need to wear a raincoat. And so right now, looks like the rain might be kind of slowing down a little bit, given the number going down below 550. And hopefully when we get there, that we could get rid of the mask. But obviously, if 3-4 months later down the road and something, and another variant came in and becomes very virulent, then certainly all that could change. It's all based on numbers, right?
That's right, and I just want to underscore that because the requirement for masking will go away, we still will be recommending masking. So it won't be a requirement, but it will still be a recommendation in indoor spaces, particularly those with a lot of people or that are crowded.
Great. Thank you, Dr. Cody. And that's all question I have, Chair. Thank you.
Thank you, Supervisor. Dr. Cody, I just, and I'll turn to both you and Dr. Smith here in a minute, but I think the first question is probably best directed to you. Just want to clarify, earlier in your remarks when you talked about the numbers a little bit, you talked about the 7-day average in terms of the case rate, and I heard you say 550 was your metric, 555 was the number, but I think I know that that's a rolling 7-day average. Am I following that correctly?
That's correct. 7-day rolling average today is 555.
So that means by definition that we're not talking about the 555 being today's number. We're talking about that being the average over the last 7 days.
That's correct.
Okay, and I'm asking that question quite candidly because I know from experience, as we've talked with you in the past, you are not inclined to make pronouncements or announcements in this venue about various requirements, including masking mandates. On the other hand, for folks who are trying to second guess where things are going, what I heard you say is not just that we dropped down today to 555, but we actually have a 7-day rolling average of 555. which means today's number by definition is going to be lower than that. Yes?
Yes, I don't usually like to be overconfident, but I can tell you that I am reasonably confident that the trends that we're seeing are going to continue, and that tomorrow our 7-day rolling average of new cases is going to be below 555.
And again, knowing that you don't like to make pronouncements or announcements in this venue, that means that tomorrow you'll look at the numbers and we'll assess, as you do every day, where that leaves you with respect to the existing mandates. Yes?
That's correct.
All right, thank you. I want to turn to the question of tests and test distribution. And Dr. Cody and Dr. Smith, I heard the conversation just now with that was prompted by Supervisor Lee's question about testing and the somewhat diminished demand for testing. But I want to share with you some numbers that I think you have a general awareness of, but that I think suggest it's a little more complex in terms of sorting out when, where, and how we distribute tests. You will recall that our board asked for a robust test distribution policy. I had a referral on that item. It was approved by the board. The staff, to your credit, worked with our library system, our county library system, which is a separate legal entity, but obviously affiliated. And as recently as the 9th, and I know a couple of weeks in COVID world can be a long time, but as recently as the 9th, I think you know that when we announced a 4-hour distribution of COVID tests at the Los Altos Library on relatively short notice, it took literally just 35 minutes before the folks there ran out. And working with that information then on the 10th and 11th at other distribution efforts and the 12th, staff literally doubled the number of masks, more than doubled the number of tests, forgive me, and yet ran out again in 90 minutes in Milpitas, in Supervisor Lee's district, in Cupertino in my district, in Gilroy in Supervisor Wasserman's district, probably a couple hours in Gilroy. And the point I'm trying to make here is, you know, we have struggled throughout this 2-year period to make sure we get to those in the greatest need, which I think our entire board supports, but also to meet our obligation to be the public health agency responding to the needs of the entire community, meaning all 2 million folks. And when I first pitched this notion of using non-traditional venues, including the libraries, you know, the point I was trying to make is that they were trusted and familiar venues, and that if other healthcare providers were unable or unwilling to step up, we needed to get testing out, and that I believed there was a demand. And what I would say is, if the 4-hour giveaway was exhausted in 35 minutes, then more than doubled, and the 4-hour giveaway is exhausted in 90 minutes in relatively middle-class suburban communities, then the message I take from that is that we got a lot of folks out there who will do the responsible thing, who will test before they go out into the broader community, will keep themselves, their families, and their coworkers safe if we give them the tools to do that. But I am concerned to hear us talk about stepping back, and I'm curious to know what the thinking is, Dr. Smith, about going back either to and through the libraries, to whom I want to say thank you again, by the way, because that's not really in their general job description, or through some other community venues. But, you know, I keep hearing from people, and I think it's just wrong, you know, look, you can run down to your neighborhood pharmacy and get a test. And, you know, I don't really think we had thousands of people lining up at our libraries waiting in traffic if they really felt that they could simply run down to the neighborhood pharmacy and solve the problem. I mean, these are folks who were apparently anxious to access literally just 2 twin packs at their local library. Dr. Smith, Dr. Cody, anybody?
Yeah, I can take this just to give you an idea of what's going on. I put up a spreadsheet. I hope you can see it. Can you see it?
I can, thank you.
Okay. So this is what the distribution has been so far. At the top there, you can see that we, the county, purchased 639,000 eye health kits. And we were given 100,000 FlowFlex kits from Stanford. We also, the public health department also got 100,000 kits that were primarily used for the jail and safety environments where there was high risk activity. And this is the distribution so far. You can see quite a bit went to the testing sites, but all over the county got a number of tests. The school districts got 36,000. Libraries did 30,000. And you can see that we depleted down there at the bottom 81,000 of the public health safety stock. So we have remaining on hand about, well, 28 plus 16, 40 plus thousand that we're planning on distributing through multiple sources. At this point, the libraries are really off the table. We had trouble with labor issues, so we're looking for other public sites that can be used appropriately. So that's where we're at this point. We continue to plan on future distributions.
Dr. Smith, I'm going to keep pressing you on this matter because, again, please correct me if I'm wrong, but after listening to our public health director and her team and you and your team for the last 2 years, the message I have taken away, the guidance I have been given, as I understand it, is the way to prevent the spread of the virus is to make sure that folks who have the virus don't go out into the wider community. And the way they can make sure they don't go out into the wider community is to test themselves and make sure they don't have the virus. Am I missing something there? I mean, I know this is a complex issue, but that piece has been pretty steadily drummed into us from every source.
No, I think that's correct.
So that is what prompted me way back in January to say, let's go on test distribution. I appreciate the numbers that you show there, the 600 plus thousand tests, but are we planning to just essentially distribute the remaining 30 plus thousand and call it a day? Or do we have plans that you can share with our committee to acquire a significant number of tests and keep going? Because every time we think we are at a moment when we can relax a bit or perhaps even celebrate, the virus comes back to get us. And I think, again, everything I've heard from you and from our public health department has been, don't go out there and share the virus if you've got it. And the way you've got it is to test. So I'm trying to figure out what the plan is to keep making sure we have tests readily available to the public.
Yes, we're ordering more tests.
And what can you imagine or better yet commit to in terms of what I'll call general distribution in community friendly, community familiar locations If not libraries, then in other venues. I mean, I've got, as you know, Dr. Smith, and this is something that is not your responsibility, so I want to be sure I say that, you know, I've now got 9 different cities in my district as a result of the vote of the board. Every one of them is saying, you know, we need help. And as I say, looking at the sort of pilot effort that was undertaken at 6 different communities with 6 different libraries, you know, I think you saw that the demand is there. And I think that that's something to be applauded. I'm really proud of the fact that people said, we will respond responsibly, appropriately, try and keep our friends, our neighbors, and our families safe, and our colleagues at work by testing and staying out of the mix in the community if we test positive. But I'm, you know, it was a one-off. It fell short, candidly, and now I'm not in a position where I know what to say to anybody who says, what are we going to do to make sure people continue to have access to testing? And if the answer is drive to a remote location in rush hour, I think we know people won't do that. That convenience is key. I know I keep saying convenience is key, but I keep saying it because it's been our experience day after day over these last 2 years. Thoughts?
Well, I'm far enough away from the actual distribution so that I can't commit to a particular location, but I can say that we're looking at what the need is, and we're also cognizant of the need to be close to the population. So probably best for me to say that we'll give you an off-agenda memo to try to give some more details, because I don't have the details today.
When is it reasonable for us to get that off-agenda memo, Dr. Smith?
I would say next week.
I find that disappointing. You know, I'd like to see that response at the earliest opportunity. And I think it is important that we are able to communicate with the folks in all 15 cities in this county, how they can conveniently access the testing that they need to do the responsible thing. And, you know, I know, as we've discussed, that people's emotional resilience is, you know, shot, frankly, after 2 years, that people feel spent. But as I say, asking folks to do the right thing and then not giving them the tools to do it, or making sure that they're readily available, whether it's through their own provider or some other means, is bound to generate a reaction. And I can't say it's particularly surprising. Let me ask Dr. Cody what her current thinking is, or what the best thinking in her field is about shots following a booster. In other words, at what time is it time to say, yes, I got my 2 initial shots, if that was the course you took, plus I got my booster, but now it's time to think about whether or not I need yet another vaccine. Dr. Cody, thoughts?
Well, the honest answer is I don't know what decisions the FDA and the CDC will be making. I can tell you that in other countries, an additional booster or 4th shot has been offered mostly to older age groups. And I can also tell you that there's now pretty good data showing that the durability of protection from severe illness and hospitalization and death is quite good. So that is encouraging. So I don't honestly know what will ultimately be recommended and implemented here in the US.
All right, but at this point, if folks are asking, hey, I got my booster, am I supposed to get another shot? The answer is not yet to be determined. Is that a fair summary?
That is a fair summary.
Thank you. Dr. Smith, I don't know if this one is for Mr. Lorenz, who I think is in the meeting with us, but I know from my office's interactions with VMC folks that, we've had more than 100 documented cases of long COVID at Valley Medical Center since, I guess October. We had a special hearing in this committee about long COVID. I'm sure most of the folks who are participating in this meeting will recall. There had been some discussion, Mr. Lorenz and Dr. Smith, about whether we needed to sort of take a more unified approach, as some venues have, Stanford being an example, in terms of long COVID as a phenomenon in and of itself, or whether we would continue to deal with it based more on the medical specifics as each case presents itself. Thoughts from staff would be helpful on this issue of long COVID.
I think Paul could give you an answer to that.
Thanks, Mr. Lorenz.
Oh, thank you, Chair Simidian. So as you know, we've been collecting data on long COVID as of October of last year. And to your point, we do have the data to suggest that we have approximately 100 or so individuals that have been identified with long COVID by our clinicians. We are monitoring the number of referrals to specialists and the work that's being provided relative to the clinical needs of our patients. We are working closely with the medical staff to determine whether or not a long COVID clinic that is specialized in serving these patients would be needed relative to the volume of patients. But I do want to assure you that from a primary care perspective and the relationship with the specialist, those referrals are being monitored at this present time. So I do not have an answer for you today, but that's something we can get back to you as we continue to monitor the situation.
Mr. Lorenz, we typically include a report from you, as you know, at our last, what I'll call kind of a omnibus item on each month's agenda. Might we ask you to comment on this next month at that time when we ask then?
We would be pleased to do so.
All right, thank you for that. And Dr. Smith, before we wrap this item up and go on to other items, I'm mindful of time. I think you can tell from both the nature and tone of my questions and comments about testing distribution, I'm disappointed in the effort, at least in areas of concern in my district. And again, I try not to be parochial about these things. I have, as the entire board has, supported a county-wide approach with the greatest emphasis on what might be called communities of greatest need. But what I need to say, just so it's not a surprise in future, is on January 11th, the referral that I brought to our board asked the administration to, quote, immediately take such steps as administration deems necessary and appropriate to multiply and accelerate the distribution of at-home COVID-19 tests to Santa Clara County residents prior to January 25th. And it was at January 25th we were going to get a broader report. And I was very deliberate in using the phrase as the administration deems necessary and appropriate, because I wanted that best professional judgment to rest with the professionals. But based on this experience, if we don't step it up for everybody, then I think you cannot be surprised that referrals in the future will attempt to micromanage in a way and to call out very specifically what the numbers are and what the expectation is in a way that is not going to be well received by staff, but that will be necessary, at least in the view of some board members, myself included, if we don't see the kind of follow through that is real out in the community. And I don't want that to come as a surprise. We tried to provide discretion here, and you know, we ended up with a one-time only distribution effort in these suburban communities that came up short in literally a matter of minutes. And the notion that there may or may not be follow-up, or there may or may not be additional supplies forthcoming is, as I say, a real disappointment. Supervisor Lee, would you like to move that we receive the report?
Yes, so moved.
Motion by Lee, second by Simidian. Clerk will call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye.
Thank you.
All right. Thank you to the clerk. Thank you to all from county staff who spoke, and thank you to members of the public for this continued item. That takes us to item number 7, which is to receive the report on the specialty care clinic that is slated for opening soon. I see Mr. Lorenz and Mr. Draper's name on the report. Mr. Lorenz, would you like to lean in on this one?
Thank you, Chair Simidian. So just briefly, as you note, March 9th is our opening day for this clinic. It is a multi-specialty clinic that will have an outpatient pharmacy and a variety of different specialties. We are first going to start with cardiology and then pulmonary, and then move on based on community need. I know that Kathy Bradley is also on the line, and she can confirm that we are on target for the opening. And we are looking forward to a ribbon cutting as well on March 9th to share with the public the new facility.
Thank you for that. Let me turn to Kathy Bradley, see what she would like to offer in the way of additional information, if anything. Welcome.
Hi Supervisor Simidian. Yes, construction is complete, just a few punch list items. Furniture is 90% installed, medical equipment is 95% installed. They're going to be completed in terms of installation next week. And everything will be ready for an opening date of March 9th. There are a few long lead items that will arrive after the opening, such as IntelliCab and IntelliVault for the pharmacy, just because it's a long lead item. So.
All right, thank you for that. I guess the one question I would have, hearing that things are remaining relatively on schedule, for which I want to say thank you for some good news, is I've heard a range of possibilities described or discussed in terms of the specialty care, cardiology, pulmonary care, endocrinology. What's the current thinking about what will be on site in addition to the pharmacy?
So, Supervisor, as you point out, the first service that will be available to the community for specialty will be cardiology. And we have the physicians and the staff ready to go. That will be followed by pulmonology. And then based on the number of referrals coming from that community, will determine what other specialties that we will put in place so that individuals do not have to travel, but can actually access service within their own community.
And thank you, Mr. Lorenz. And is it fair to say that the expectation and certainly the goal here is to supplement and complement what's happening on the same property at Planned Parenthood, so that folks can continue to get primary care and reproductive health care at Planned Parenthood if they choose to do so, and then other services which might not be available, would probably not be available at Planned Parenthood, would be available literally on the same property through our VMC efforts?
That is correct. It is a partnership, and we will be working very closely with Planned Parenthood.
All right. I don't have any other comments or questions on this item, except to say thank you, and I'm looking forward to an opening date, and glad you're going to do a little publicity to let the world know that we've arrived on the scene. And let me see if Supervisor Lee has comments or questions before I ask the clerk if there are any public speakers on this item.
Chair, on the cardiology, it's really exciting that this is one of the first services that we put in. Is this basically based on the community need, that there's a need in community that the cardiologist clinical services has been lacking? That's why we want to get that implemented as soon as possible.
It is one of the specialties that is needed in the community. I would say that given the way that we're currently experiencing wait times, it's across most specialties these days in terms of healthcare, given the fact that we're coming out of COVID and more people are accessing care.
Right, thank you. And as mentioned, this is definitely not doing any duplicative service of what Planned Parenthood is doing, but so it would actually be complementary of what they're doing, what we're doing as well, correct?
Yes, Supervisor. Again, it will be complementary, and we will be working closely with Planned Parenthood.
All right, great. Thank you. And that's all questions I have. Thank you, Chair.
Thank you, Supervisor Lee. Let me turn to the clerk and ask if we have any speakers on this item.
We do have 2 requests to speak.
All right, let's go right ahead and give those folks up to 2 minutes, please.
All right, the next speaker is Joni Murphy. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi. I don't know whether I missed the public comment or not. Did I miss it about the masks, etc.?
That was item number 6, where we talked about COVID. That item has come and gone. I did, however, indicate that at the end of items 10 and 11, the last 2 items on our regular agenda, we will open it up and see if there's anyone still with us who would like to speak to item 6, which was the COVID item. Okay?
Okay, so I just have to hang on.
If you want to speak to that item, you do. Yes, thank you. Let's go to our next speaker.
Next speaker is Rivish Kumar Mehta. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Again, thank you very much to Board of Supervisors, Chairperson, Vice Chairperson, as well as the county, Santa Clara County health officials. I wanted to emphasize on how the United States city considering the sale of menthol cigarettes within the cities. It is very important to understand that there are certain cities where they are making the important step to making sure that what are the additives, what are the additives products, they are dangerous to the health, and as well as not being to the
Excuse me, let's ask the clerk to stop your time. I think this is that you're wishing to speak now on item
number 11.
Yes, we've not yet reached item 11, so if I can ask you to wait until that time, we will take that item up either at 4 sharp or as close to 4 as we can, okay?
Sure, no problem. Thank you very much, sir.
Thank you very much. All right, turning to the clerk, anything else on this item?
That concludes our request to speak.
All right, then we have a motion from Supervisor Lee, I believe,
yes,
and a second from me. We've heard any speakers, so let's go ahead and ask you to call the roll.
Vice Chairperson Lee.
Aye.
And Chairperson Simitian.
Aye. Motion carries unanimously. And Mr. Clerk, I believe that takes us to item number 8, yes?
Yes, indeed.
All right, then let's go to item number 8 and see who do we turn to for a report on this item. Is this Mr. Lorenz again?
No, I think Kathy Bradley can give you an update on where we are.
All right, Ms. Bradley.
Negotiations.
Sure, Supervisor. I can give you an update. So as you know, we had a list of potential sites that the county reviewed. There were some drive-by visits, and then there was a short list where there were actual tours of the sites. Based upon the tours, it was again shortlisted to the 2 primary sites of interest. So on February 11th, the county issued letters of interest to both of these properties with proposed terms, etc. One of the properties responded just yesterday, and we are evaluating their response and their counter proposal. The other property, we are still awaiting their response. That one's a little bit more tricky because it was a sublease, and so we had to work through the current tenant to directly with the landlord. And so we are working through that. Once we have both, we will present it to the administration to receive direction on which one to pursue or to continue to pursue both until such time as a final decision is made. And so we're currently just negotiating terms of the LOI. Happy to answer any questions.
Sure. So let me just ask, the LOI is the letter of intent, yes?
Yes, the letter of interest, correct.
Letter, and let me just make sure I see both terms used. So the I've heard letter of interest, you've used letter of interest, it says letter of intent in the document. Is there a difference between these two things, or are we talking about the same kind of document essentially?
I think we're pretty much talking about the same type of document. I mean, this one, it breaks down the proposed terms, the lease rate, the time period, tenant improvements, et cetera. So yeah. And
forgive me, I didn't quite track. I think you said that you had sent something to folks in the first week in February. Was it February the 2nd, Ms. Bradley?
February 11th.
11th. And what was sent by our county to the 2 properties on the 11th?
It was the letter of interest, although I'll have to double check, but it was a lease proposal. I mean, formally we wrote it as a lease proposal for each of the properties.
Okay, and those documents have been sent. This is not something that was planned. This is something that has happened. Yes,
it has been sent, and we've received a response on one of them already. So
okay, so on the one that you've received a response from, is it fair to say that you're evaluating that response? Did I hear you correctly there?
Yes, we just received it yesterday, so we are evaluating it.
Okay, and on the second one, at the risk of stating the obvious, but I just want to be crystal clear here. Thank you for your patience. You can't evaluate a response you haven't gotten yet, so you aren't evaluating anything because you haven't gotten a response yet, but you have sent the initial letter to the second of the 2 possible sites, yes?
Correct.
Got it. All right. I will just ask that we maintain a sense of urgency on this. I appreciate that. We are exploring some other possibilities with other potential partners. In addition, I want to underscore that, in addition to looking at a site in this area. And I want to thank the county executive for that. It's helpful and appreciated. Supervisor Lee, anything you'd like to either ask or comment upon?
No more question. Ready for motion.
All right. Well, I am happy to ask you to move the recommended action, which is simply to receive the report.
Yes, so moved.
I will second. Let me check with the clerk to see if we have any speakers on this item.
We do have a request to speak.
Okay, and the requester hopefully is speaking to item number 8. I know it's tough sometimes to track in these Zoom meetings which item we're on. This is item number 8, dealing with the creation of a health clinic in District 5. Go right ahead.
Next speaker is Uvish Kumar Mehta. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much, Board of Supervisor again. And again, thank you very much to the staff for the report. I wanted to acknowledge the fact that though under with the COVID-19 situation, we have been improving on the facilities that is required to be operated within the County of Santa Clara and the requirement. However, it is important to note here that under the pandemic, there are quite a few different variants they have impacted the citizens in a different ways. There are also Omicron variant, they have impacted the citizen in different ways. And there are different facilities which has been getting operated within the Stanford healthcare facility as well. For example, as we were talking about the specification of cardiologist facility. In the similar way, as more and more facilities are coming up, it is important to also identify that how those facilities within the specific district helping out the citizen. For example, for particularly for the veterans' health, they will have to travel all the way to the Palo Alto Veterans Facility in order for the health issues to be taken care of. Now, it is important to mention here that as new facilities, which is coming up to address the health and hospitality issues, those facilities are required to be operated within the jurisdiction and as well as the legislative body of where they would be able to be help out and being operated in a way where they are just not serving the citizen, they are serving the entire whole citizen system that includes armed force services, officers, different commissioners serving to the county, city, and as well as state. Also to ensure that when these new facilities are being operated, there is a report that is required to be formulated as well to be provided to the city and as well as to the state, such that those citizens being aware of those new facilities.
And that concludes our request to speak.
Thank you. Then let's ask for a roll call vote on item number 8 after I say thank you to the member of the public who chose to speak on this item.
Vice Chairperson Lee.
Aye.
And Chairperson Simitian.
Aye.
Thank you.
And that motion carries unanimously. That takes us to item number 9. And on this one, we're going to hear from Renee Santiago. This is the report regarding home and community-based services spending plan. I apologize. I need to step away for just a couple of minutes. I will be back. And my apologies to Mr. Brownstein as well, who I know has been waiting patiently through this whole meeting. But Supervisor Lee, if I can ask you to pick up the presiding duties here for a minute, I will return.
Thank you, Chair. Will do. Okay, I'll go ahead and open up to item number 9, which is the receiving the report from the Working Partnership USA relating to California's home and community-based services spending plan. Today we have our expert strategic advisor, I'd like to call him Professor Bob Brownstein here today. Hi, Bob.
Good afternoon.
Good afternoon. Good afternoon.
So what I would like to do is take the opportunity to make the annual report of the Working Partnership Stakeholder Group to the committee and do it on the California Home and Community-Based Spending Plan, which is a massive project that the state of California. See, I just get there. We go. That the state of California has initiated, and
we can see it. Yes, go ahead.
Okay, let's see. And I refer in this analysis of the spending plan to crisis and opportunity. This plan deals with a number of extremely critical types of services, particularly services dealing with people who are disabled or homeless or who are in need of assistance with daily living. And it provides us with a substantial opportunity to be able to meet the needs of those people. However, nothing is automatic under this plan. There's 27 initiatives. It's necessary to fully understand what the state is asking for and also how to apply for resources. So it is a genuine challenge to take maximum advantage of this very substantial program that the state is putting together. The plan is largely the result of the American Rescue Plan Act of 2021. It's an increase of 10% in the federal medical assistance percentage, which amounts in the state of California to over 2 years to over $3 billion. Very substantial federal funding is making this program available. This will be one-time money. We have a substantial amount of time to plan how it will be spent. We don't have to start spending it until 2024, but the funds will have to be spent by June of 2026. The funds will have to be supplemental to existing HCBS spending by the state of California. The money can't be used to supplant existing programs. And what I'd like to do at this point is go on to talk about several of the specific initiatives. As I said, there's 27. We won't have time to go into detail beyond more than a few. I will say at the outset, though, one question that people often ask is, okay, the overall state program is over $3 billion. How much is going to come to Santa Clara County? And the answer is, at this point, it's impossible to say. It's impossible to say because most of the money is not going to be allocated in a formulaic way. It's going to be incumbent upon us to take actions in order to be able to access the resources. And in some cases, it's not clear at all what actions we have to take in order to be able to access the resources. The state is still in the process of putting the details of the program together. So one of the programs that I would like to call your attention to is an IHSS Career Pathways program. The goal here is to improve the training for IHSS providers who have clients that have significant behavioral health needs or dementia. Whether or not the providers want to participate in this program is voluntary. They don't have to choose to get the training and get the incentives. But if they do and they complete the training, they will get a one-time payment. The state's hope is that the training will be linked to career pathways for people in IHSS, and some funding will also be made available for counties to make sure that the IHSS providers know that this opportunity exists. But there are many questions that are unanswered about this program, which to many of us seems like moving absolutely in the right direction in terms of increasing the skills of IHSS workers and also providing them with additional compensation for upgrading their skills. It's not clear what training programs have been shown to help providers care with clients with these complex needs. It's not clear whether those programs, once we know what they are available in Santa Clara County. And it's not clear to what extent training programs would be linked to career paths, or whether or not it's really necessary to create new career paths to keep IHSS providers in the field. Another very substantial program is the Housing and Homelessness Incentive Program. Statewide, $1.3 billion will be allocated to this program, and the funds will go through the managed care plans in Santa Clara County, Santa Clara Family Health Plan, and currently Anthem Blue Cross. These funds can be used for home health care, LTSS services, nursing care, and case management. However, unfortunately, none of the funds can be used for room and board. So we will have funds to provide excellent services for people, but not funds to actually house people or to pay for their room and board if, for example, they're in an RCFE. The managed care plans are directed to collaborate with county departments and city housing departments. And the managed care plans are told they must produce a very extensive document for review by the state that indicates the kind of programs with services for the homeless that are in existence now, what needs are not being met, what gaps exist in terms of services, and how the managed care plans would use these resources in order to meet these needs and reduce those gaps. There are a number of questions for this program as well. Who will pay for room and board if these funds aren't available for room and board? Also, the current language for this program suggests that the state will not be paying managed care plans until the state determines that some of the metrics that it will be using to evaluate the program will have been met. And then the question arises, well, who will be paying for the services while we await the state to determine whether the metrics have been met and someone can draw down on these funds? This last one is a much smaller one. It's a CalBridge pilot program that provides grants to have behavioral health navigators in emergency rooms. And these navigators would have the mission to screen patients in the ER and possibly intervene or make a referral to a mental health or substance abuse program. Grant recipients could be acute care hospitals, hospital foundations, physician groups, et cetera. And I put this small one in the list just to raise the question, are hospitals in the county aware of this opportunity? Because something that seems to be a potential issue with many of these initiatives is that potential beneficiaries don't know the initiatives exist. And a question arises as to what mechanisms will be in place so that people will know that there are opportunities so they can take advantage of them. We really have only one recommendation to the committee because of the complexity of these initiatives and because of the very high stakes in terms of the resources that are available. There is a working group of community stakeholders that's trying to get a handle on these issues and figure out the best way to maximize the benefits to the people of Santa Clara County. We really would appreciate having the county itself be a part of this effort and engage with stakeholders so we can try and do the best we can in terms of this program. So I'd now be willing to answer any questions you may have, just with the caveat that if the questions are very detailed, in the vast majority of cases, my answer is going to be, I'm trying to find that out too, as we try and await the state to provide more clarity on exactly what needs to be done to access these resources. Thank you very much for the opportunity to discuss this issue.
Yes, thank you, Mr. Bronstein. Is there anybody else who would like to comment on this? And actually, I might have a couple of questions to ask. This is a lot of state funding coming through. And Mr. Bronstein, how much do you think Santa Clara County could be expected to be receiving this under this plan? And it's all based on how much of the applications being filed to ask for funding. Is that correct?
In many cases, it's based on a county making an application. In the case of the homelessness incentive program, it requires the managed care plans to make the application. I mean, in something like the IHSS incentive program, the county will get resources to allow people to find out that the program exists, but it will really depend on each individual IHSS worker whether they choose to take the training and make themselves eligible for the incentive. The county can make sure they know about it and make sure they understand the advantages about it. I think one of the things the county and stakeholders might do is try and see if we can try and have clear connections between the training that's available to people and real career pathways in the direct care field, so that people may feel that the training isn't just a one-time benefit, but something that will help them have a career moving further in their lives. But because of these kinds of uncertainties, it's very difficult to say exactly how much money is going to come in. And in some cases, we don't really know exactly what the state wants us to do yet to access these resources.
Right. Reading on the item regarding the workforce category, I would like to also highlight expanding the homeless system of care as being one of my areas of interest under the PATH funds for homeless and the HCBS direct care providers. Would staff be able to comment a bit further on this item beyond the couple of sentences being provided? Certainly would appreciate it.
Unfortunately, there isn't a lot more available yet on that. Most of what the state has provided us with is information indicating the importance of bringing people into the field so that there will be enough direct care providers, which I think we would all agree with. I think I think we would all agree with a lot of the things the state wants to spend money on, like recruitment and training, et cetera. I think the question many of us will have is that enough? Is the problem with getting people into the direct care field going to be solved with things like training or recruitment? Or are there going to have to be some fundamental changes into what this work is like in terms of the ongoing compensation, the benefits that are available, the respect that people receive in the field? I mean, right now, for the people who are in direct care and working for skilled nursing facilities and assisted living facilities, and they're generally better compensated than people who are working in home care, the turnover rate for those people, the ones in skilled nursing facilities and assisted living facilities, is over 100% per year. Turnover rate is over 100% per year. And that suggests to me that the problem is probably deeper than one that can be resolved by recruitment strategies and training strategies, although I certainly support recruitment and training.
Right. Now, under the Housing and Homelessness Incentive Program, stated as about 1.3 billion under the transitions category. Can you elaborate about this submission of the homeless plan to DHCS and the amount of funding that we should be looking to ask for at this point?
I can't. Here's what the state basically says. Funds would be allocated by point-in-time counts of homeless individuals and other housing-related metrics determined by DHCS. Well, there's just no way to turn that sentence into a number. I mean, it's too ambiguous at this point. I think the fact that they're looking at a point-in-time count of homeless people will get more resources into Santa Clara County. We have a lot of homeless people in Santa Clara County, but at this point, we don't know what the other metrics are going to be. So I think it's incumbent upon us to be paying attention to what the state is doing on this issue. I mean, as I say, it's $1.3 billion statewide. It's a lot of money. I think we want to participate in the way the state makes these decisions if they'll be willing to listen. But in the short run, we just can't say that we think a certain amount of money is going to come to Santa Clara County. I mean, if you want to use the back of the envelope assumption that Santa Clara County, if everything's done fairly, gets 5% of whatever is allocated statewide. 5% of 1.3 billion is a lot of money. That's $65 million of services to homeless people. We clearly want to be paying attention that we don't miss out on getting our fair share of that.
Okay. Now for the $340 million allocated to the Community Care Expansion Program, there's the mentioning of acquiring, rehab, and constructing facilities. What can the county do to best position ourselves to acquire or construct new adult residential facilities or residential care facilities based on this?
Well, first, although the state says build, acquire, or rehab, the information they're providing indicates that rehab is not their preferred option unless it's a situation in which an existing facility is going to go out of business unless you take it over and rehab it. They would really like counties to expand the number of facilities that are there, either getting one and physically building it bigger or building one in the first place. And it would seem to me that the best way that the county could position itself to get resources in this regard is to identify a site and start working on a development plan that it could show to the state. And probably the fastest way to show that you've got site control is to use sites that you already own. So if you wanted to do this and demonstrate that you could clearly make it happen, you'd want to use county-owned land, I would think. I do want to point out that the state is thinking of acquiring or building RCFEs. These aren't 500-unit facilities. These are small facilities, and the county might want to do a couple of them. But if what the county's interested in, and I know there are some people who are, including myself, who are interested in the county getting involved in something like a bigger skilled nursing facility, this program isn't aimed towards that. It's aimed towards these smaller board and care size facilities.
Supervisor Lee, this is Supervisor Smitty, and let me step in at this point because I'm mindful of the fact that we have a 4 o'clock time certain item coming up. And also I see that Mr. Santiago's hand is raised. Okay by you, Supervisor, if I go to Mr. Santiago and try and bring this item in for a landing?
Perfect. Thank you.
Thank you for picking up the slack while I had to step away. So, Mr. Santiago?
Yes, and good afternoon, Mr. Chair Sabidian and Vice Chair Lee. Bob and the stakeholder group obviously are correct. Some of the confusion around this is because the financing is based on the FMAP. That is a 10 percentage point increase in the matching rates between state and federal funding. The state has a lot to say in terms of the distribution of these funds. And we're keeping track, working very closely with Dr. Smith and the county executive team to make sure that we don't miss any opportunities. Some of these things are going to come through the RFP. Some of these things are going to be going through the managed care plans. Some of it is going to be just a straight allocation to the counties. So it's going to be very incumbent upon us to not only monitor this, but work with very closely with all the stakeholders to make sure that we get our fair share here in the county of Santa Clara.
All right, then. Thank you all very much. And Ms. Brownstein, I'm going to limit myself to just one question because we do have a 4 o'clock time certain item. But I found the much of the information from the state to be very much focused on process and structure, which I understand and believe is important. But I found it tougher, frankly, to say, all right, if these billions are spent in additional funding for folks who receive service in their homes or in their communities, how will an individual's life be better? What how $4 billion later, how is somebody's life better? And I know that calls for some speculation, but being a little bit optimistic but realistic, what's your take on that?
I think the 10,000 height look at what the state is trying to do is it's recognizing that with the demographics in the state, it's an aging population. There are more and more people who are going to have difficulty taking care of themselves, and the state wants them to avoid having to go into an institution unless it's absolutely necessary. So people's lives will be better because they will be able to stay in the community and get the help they need for all the multiple things that, most of us take for granted, but as people get older and as their capacities diminish, they need support to be able to handle. And that's the big picture, I think, with what the state is trying to accomplish. It happens to be a goal that I agree with, but this is one where the details, as Mr. Santiago indicated, are very, very critical. And we have to be watching all the different components of this to be able to make it work as best it can.
All right, then. Thank you very much. Did we ask Supervisor Lee while I stepped away if we had speakers on this subject?
We have not taken public comment yet.
All right, then let me ask the clerk to advise us whether or not there is public comment on this item.
There are 2 requests to speak.
All right. Again, folks, this is item number 9, and we will allow up to 2 minutes, but please be sure your comments are for item number 9, the home and community-based services conversation. Let's go to our first speaker.
Next speaker is Kai Y. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. Timer will start when you begin speaking.
Hi, thank you guys once again for allowing respectful dialogue around this complex problem. I read a really good book by Michael Schellenberger called San Francisco. He is a Democrat, and I'll tell you why that matters is because he's seen the problem in San Francisco, in Cisco, about this complex, very hard to deal with problem. And he's arguing that it's not about money because he poured in billions of dollars. It's about allocating the right money to police who can actually do something about. I'm not saying all the problems are a result of drug addiction and crime, but a lot of it is. A lot of it is. And if you allocate the money to law enforcement so that they can empower them to do the right thing. You know, like I think what you guys are doing is noble in that you guys are trying to care for the poor and marginalized and stuff like that. But what about us? What about families with kids who kind of actually have to see this, you know, around where around where we are. You know what I'm saying? Like, so at the least, like, hear the argument that it's not about money. It's not about putting more money into this problem. It's about respecting the police and honoring the police. It's about giving them the capability to do what they have to do. You know, like, again, I don't want to say that it's all about, not everyone that's homeless has drug problems, but by and large, you know, Michael Schellenberger argues that in his book, San Francisco, it is a big problem with that.
The next speaker is Ubish Kumar Mehta. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much to Board of Supervisor, Chairperson, Vice Chairperson. On most of the, when we talk about the building a better home and the care coverage services for the people, what becomes important is that, you know, what are the comprehensives that we provide, and also, you know, we evaluate that where the citizens experiencing the challenges accessing those services. Now, taking a look at both the part that the services being provided and the services, you know, where the challenges are there. Now, what becomes important is that access to the services, you know, which are unavailable to the remote areas where people are actually in a need. And that's something we are talking about the rural area. Now we are talking about the urban area. There are services available. However, what are the equity rates, adequate payment rates, encouragement of a culture and linguistically content community that, you know, we can address, you know, those challenges, you know, accordingly as well. So what we are leading towards? We are leading towards making the rural area more compatible, where the services required to be available, and in the urban area where we are doing a more enhancement, where the community care and as well as the services, you know, where challenges are being experienced with the linguistic minorities and as well as with the cultural minorities. That's something, you know, we are trying to address. However, what also becomes important is the funding, that, you know, how to devalue that and in what community and what particular community where the home-based services are required. We are talking about San Francisco real estate development market. There are many opportunities, but however, where we are addressing the homelessness, that becomes important because San Francisco is a sanctuary city. Thank you very much.
The next speaker is Anthony Romero. I'm unmuting you.
Please and one moment, please. We had just 2 speakers. How many do we have queued up at this point?
There is 1 speaker in the queue.
All right, with that will be our last speaker, everyone. Thank you very much.
Final speaker is Anthony Romero. You have 2 minutes to speak. And go right ahead. Anthony, your mic is live. Go right ahead. Anthony, are you there? All right, Anthony is not responding, so that concludes public comment.
And Mr. Clerk, where are we?
We just finished public comment for item 9. It has not been voted on yet.
All right, but that is our last speaker, yes?
I can try one more time for Anthony Romero if I tried the last couple times. All right.
Please do.
Anthony, last call, 2 minutes to speak. The timer will start when you begin speaking.
Hello, can you hear me?
Yeah, go right ahead.
Thank
I
you.
apologize. Thank you, gentlemen, for your time. And just kind of echoing Kai's comments, the first speaker, I understand and appreciate what you gentlemen are doing, but unless these programs are going to kind of force these people into them, I highly see these as unbeneficial. And the reason being is because it's, number one, I don't think we would have this problem if, the governor wasn't inviting people over like it was a birthday party. And then at the same time, I don't think, like he was saying earlier, I don't think throwing money at this is the problem. I think that there's a deeper root to this. In most cases, these people are escaping some sort of, circumstance at home. And I think them just running away from it isn't solving it. And unless you're going to, like I said,
Hey, I was just
sorry,
gonna.
please don't cut me off. And unless you're going to put them into these houses, they're not going to do it. There are services available now that they are refusing to take and take advantage of. And that's not your fault. More money isn't going to make them get into it and change their mind. And it's like the gentleman was saying earlier, these people that are out here are, they're way beyond any reality. And I think it's hard to have dialogue that seems that's going to help them. I know that there's other problems, and like I said, I think this money, because you're asking to spend this money on people that aren't even from California. I think that there are people that are from California who could use this money better. You have people from all over the nation in here right now who are just taking advantage and soaking up these free resources, and you're just going to give more money to them. That's completely disrespectful to all of the people who do pay taxes here, who do go out of their way to make this community better and want to live in California. I think that's completely disrespectful. And I wish you guys would take that into consideration when you're taking, I hate that Mr. Brown left and doesn't want to hear me speak right now. We all sat here and listened to him speak. I think that's completely disrespectful. Thank you, gentlemen, for your time.
That concludes our request to speak.
All right, let's ask that we call the roll, please.
Yes, on my motion to receive the report. Yes.
And Samiti and I as well.
Thank you very much.
And that means the item is approved. All right, everybody, let's take a deep breath. Thank Mr. Brownstein again. Thank members of the public who chose to speak. And thank you, Mr. Santiago, for weighing in, adding a little bit to the conversation as well. Thank you, Supervisor Lee, for stepping up to preside while I had to step away for a few minutes. Again, my regrets. And that does mean that the hour of 4 o'clock has arrived, and pursuant to our published agenda, we have a time certain item, which is item number 11, which is to receive the report from the Public Health Department relating to tobacco and vaping enforcement in Santa Clara County. And we do have a very good written report. This item was agendized at my request, Supervisor Lee, because I had some interest out in the community about the status of enforcement, excuse me. Let me just ask Public Health, whether that's Dr. Cody or one of her staff who I see popping up on our screen. The short, simple answer, if there is one, if somebody said, is it legal in the unincorporated county to sell flavored tobacco? Is there a yes or a no answer to that?
It is illegal.
It is illegal, meaning
It is. Yes, correct.
Okay. And that's whether you are 12, 22, or 92, correct?
Correct.
All right. If I asked you the same question, but said, is it legal or illegal to sell vaping supplies in unincorporated Santa Clara County? The answer to that question is what again?
It is illegal to sell vaping products, electronic smoking devices in the county unincorporated.
And if I said again, is that true whether you are 12, 22, or 92, you would say?
Yes, that's
All
correct.
Right. Not age specific. All right. Then we have the report. And thank you again for that 8-page report, which I know Supervisor Lee and I both had a chance to look at, as well as the colorful chart on packet page 78. And let me just ask the clerk if we have folks who are here to speak on this item, because I think that might help inform any discussion we have today.
Yes, we do have currently 8 requests to speak.
All right, let's give everybody up to 2 minutes. If they can spend a little less, that's great, but I know that there are a range of issues here. So let's take them in order and see how we do.
First speaker is Jade Chow. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. I'm sorry, Jade Chow, you're using an older version of Zoom, and it won't allow me to activate your microphone. You might be able to try logging in with a different browser, perhaps. But the next speaker will be
And let me just
Stephen Lee.
indicate for Ms. Chow and anyone else, we will come back to you at the end of this list of speakers to see if you've got another way to log in, even if it's just on your cell phone. Go right ahead, Mr. Clerk, to our next speaker.
Next speaker is Stephen Lee. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon. My name is Stephen Lee. I'm the Vice President of Advocacy for the Palo Alto Council PTA. I am here to ask that the county step up its enforcement of the retailer ban on the sale of vaping devices and flavored cartridges. Last autumn, I was able to walk into the Law Smoke Shop on California Avenue here in Palo Alto and purchase both a vaping device and a mango flavored cartridge. These and numerous other items were displayed openly and sold in contravention of the vaping ordinance passed by our city and which the county has agreed to enforce. This occurred nearly a year after the ordinance went into effect and after at least 1, if not 2, prior inspections. These are retailers who actively opposed the ordinance in the first place and who were aware on day 1 of what was expected of them. The fact that I was able to purchase these devices nearly a year later, and after 1 to 2 inspections, clearly shows that these retailers are openly flouting the rules. I've also heard that the prior week, a parent's 13-year-old child was similarly able to purchase these vaping devices at the same location, and that other retailers in Palo Alto are similarly selling these devices, but perhaps more covertly. It took the county an additional 2 inspections in order to get full compliance from this particular retailer for a grand total of 3 to 4 inspections. It is clear that these retailers are feigning ignorance of the law and are not working with the county in good faith at all. They do not deserve the leniency that the county has so far shown, in which the county typically shows other types of good faith retailers. It's time that the county use its existing power under the ordinance to force compliance by temporarily suspending licenses when violations are inevitably detected. I thank you for your time, and I ask for your quick attention to this matter.
Next speaker is Eileen Kim. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Eileen Kim. I'm a Palo Alto resident with 2 children in middle school. I'm a pharmacist by training and hold a PharmD degree. Past clinical work includes working in a downtown hospital, as well as working in the community. I'd like to share a story with you that is all too common and happening right here. This involves a Palo Alto family whose son attends Gunn High School. They moved from Chicago to Palo Alto and were new to the area. The son wanted to fit in, as kids do at this age, but unfortunately ended up with the wrong crowd and started to smoke vapes. He quickly became addicted, and that summer, while other kids worked and attended camps or helped out around the house or went on vacation, this young man went into rehab. It was awful. The mother of this teenager cries. Her son is still addicted to vaping despite having gone through multiple rehab stints. Now, you may be asking, why couldn't this teenager quit vaping even after having attended multiple rehab programs? The answer lies in the addictive nature of vaping. It's highly addictive. For instance, a jewel pod contains up to 5% nicotine, which is equivalent to a pack of cigarettes. A pack has 20 cigarettes, but teens don't stop with 1 vape pod a day. This addiction goes beyond the chemical addiction because it's psychological. With an instant delivery system from inhaling the chemical, it forms an instantaneous drug reward feedback mechanism that's incredibly powerful and difficult to break as a habit. Add the social habit of vaping with friends and it's a done deal. We have vaping addicts for life, a generation of vapors who never quit due to this powerful habit. But it's even worse than addiction. There is no cure. In smoking regular cigarettes, there are nicotine cessation products for adults. However, for growing teenagers with developing brains and bodies, there are no studies, no approved nicotine cessation products to aid in quitting smoking regular cigarettes. Are there any smoking cessation products for this new phenomenon of vaping? Absolutely not. We have absolutely no product to help teenagers quit vaping. There is no cure. So please help making sure we protect our children.
The next speaker is Sumita Vasudeva, I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi.
Sumita, there you go.
Yes. Yes, my name is Sumita Vasudeva. I am a past VP of Health and Wellness on the PTA Council, and I am an avid follower of the Cal Schools data that reveals the health trends and gives us a clue as to how the school community can preempt and act upon these trends. It was exactly this trend that guided us to act upon vaping. And with the concerted effort of the community, we succeeded in ensuring that vapes are not sold in our community, especially the flavored vapes, as they're called. And I happen to work in the field of preventive medicine. So I'm here to support the ask for enforcement on the sale of vapes. I'm also here to push for 2 additional supports in recognition of the fact that enforcement alone may not subdue this problem. I hope that this committee will take upon itself to deter adolescents from experimenting with harmful and addictive substances by collaborating with the community on education as well as behavior change therapies. But bottom line, for now, we need enforcement. And even though we recognize it may not alone resolve this problem, it is the first step we have at our disposal right now. So please support our ask and encourage our community to resolve this problem through education, therapy, and law enforcement. Thank you.
The next speaker is Erwin Morton. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
My name is Erwin Morton. I am a 40-year resident of the county. That's 40, not 4. Flavored tobacco products are designed to hook children on something that does lifelong damage to their health. Anything we can do to make these products less accessible to kids is a plus. I want to thank the supervisors and several city councils for voting to prohibit the retail sale of these products. And yet, these harmful products remain available for purchase. It's not as if the retailers are unaware of the prohibition. In Palo Alto, they strongly opposed the ordinance and they spoke against it at city council meetings. But infrequent enforcement and trivial penalties allow them to treat it as a cost of doing business, and a minor cost at that. We all want to help and support our local businesses, not shut them down or make them unprofitable. If a restaurant inspector spots a cockroach, we want the county to work with restaurant staff. But we might think differently about a restaurant that decorates the diner's plate with live cockroaches or buys them in bulk and scatters them around the kitchen. Retail sales of unlicensed prohibited products are not accidental. They would seem to be willful violations. So I'm here today to ask for stepped up enforcement, more effective penalties, and if needed, additional funding for enforcement. Thank you for your time and your consideration.
Next speaker is Mike Rogers. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, this is Mike Rogers. I wanted to talk on a little bit different aspect of the existing legislated prohibitions. They are nakedly too broad in a number of respects in that they prohibit all flavored tobacco products when there's been a long history of such products in some businesses and some business segments. And specifically in Palo Alto, for example, banning all flavored tobacco products nearly wiped out an 80-year-old business whose primary product is actually flavored pipe tobacco. And in this country, the majority of pipe tobacco is actually sold as flavored pipe tobacco. That's now prohibited in Palo Alto and a number of the local cities. My advocacy is for more specifically targeted legislation that's more accurate to the problem at hand, which is juveniles, vaping, and flavored products for vaping that are targeted by and used primarily by juveniles, while there are a number of other segments of flavored tobacco products that have been important to citizens and residents and businesses. So I'm all for higher enforcement on the existing laws. The more mature businesses have been in compliance, and a large number of small businesses have been in violation of the existing ordinances. So I'm strongly in support of eliminating those risks, especially to the pediatric segments of the population here, for which this has been a great problem, but should deal with it accurately in what we're enforcing and what we're writing into new legislation. Thank you.
The next speaker is Lama Rumawi. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi,
Yes.
hi,
Go
can you hear
ahead.
me? I'm Dr. Lema Rimawi. I'm a pediatrician in Palo Alto, actually, and I'm here because this is affecting my patients directly. We have hundreds of patients in Palo Alto that have been affected by the easy access to vapes. We know that having easy access to vapes increases teen addiction rates. In fact, the closer a school is to a vape shop, the higher the vape usage in that school. And we know that vaping is associated with increased drug use, illegal drug use, as well as mental health issues, which a lot of our teens are grappling with post-COVID anyway. Adolescent brains are still developing, and vaping can cause permanent structural and chemical changes that affect their development and cause long-term problems for these youths. There's no safe way to vape. Even when nicotine is not in the vapes, the chemicals are unhealthy and negatively affect these children's lungs. I would ask that enforcement be taken just as seriously as we would take it if anyone tried to obtain narcotics illegally or any other illegal substances. These are our children's lives at stake, and I would ask on behalf of my entire patient population to please increase enforcement as much as you can. Thank you so much.
The next speaker is Vanessa Marvin. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, supervisors. My name is Vanessa Marvin, and I'm one of the co-chairs of the County-wide Tobacco-Free Coalition of Santa Clara County. And our coalition works to provide education, cessation, to engage youth, and support enforcement on tobacco issues across the county. So we wanted to thank you for your leadership and for holding this hearing today to keep the focus on these issues and to make sure we're always moving forward as a county. The coalition and our members are really proud of the work we're doing across Santa Clara County to protect residents. In fact, you may have heard that just last year, the Tobacco-Free Coalition advocated to pass a flavored tobacco ban and a flavored vape product ban in the city of San Jose. With 600 plus retailers in the city, that policy makes San Jose the largest city in the US to ban the sale of menthol cigarettes and other flavored tobacco products. So we're really proud now that 9 out of the 16 Santa Clara County jurisdictions have restrictions on the sale of flavored tobacco products. It's really exciting that so many cities have followed the lead of the county supervisors. These policies are important to protect young people and communities of color. And of course, as everyone has said, we need to make sure that these policies are actually enforced, because obviously having policies on the books doesn't do enough to protect anyone. So thank you again for your leadership and for continuing the discussion on this issue. We look forward to continuing to work together with you and the County Health Department to protect residents of this county from the harms of tobacco. Thank you.
Next speaker is Margot Sidner. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, Chair Simidian and Vice Chair Lee. Thanks so much for holding this hearing. And above all, thank you for consistently being a great role model for tobacco policy work throughout the state. And I understand that you have set aside this time for us, and I thank you for that, because it is a very complex problem that we're up against. I'm the CEO of Breathe California of the Bay Area, Golden Gate, and Central Coast, and we've worked since the advent of vaping products about 2014 consistently throughout the county to try to fight this. And we've only really started feeling somewhat successful the last few years. And that is because of the policies that have been passed. It's always very important not to rely just on education when you're talking about teens. We have to have policies that protect them. And unfortunately, just passing the policy isn't the end. We have to have enforcement of those policies, which is very important. We've been working across the spectrum of education. We work with parents, with teachers, and recently have done more work with peer-to-peer models. And that's been funded by the county, and I'm sure it's probably in that 70-some page report that I haven't had time to read yet. But Nicole can fill you in on that. It's been pretty exciting, but we know this is just the tip of the iceberg. And so I'm here to ask you, please, to increase enforcement as much as you can and to help us with the very complex issue of vaping. Thank you.
Next speaker is Ubish Kumar Mehta. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much to Board of Supervisors Chairperson, Vice Chairperson. I wanted to emphasize on the ordinances that is being proposed for the smoking cigarettes, cigar vapes, and cannabis that is to be prevented. Now, it is important to note here that there are always exceptions, that are being made, and the product distribution system, they find other way around to reach to the people who, in order to have the addiction. And nevertheless, we understand that any kind of addiction on a day-to-day basis does take place. What we do is that we are being affected by some kind of some kind of addiction and abuse from that in certain manner. For example, when we work, there are instances that we do have to drink a coffee, but that does not mean that what we are taking as a part of getting the addictive in order for the more energy to consume in order to accomplish something. Now, it is also to make sure that in the same way the tobacco and the vaping works as well. Though we put the ordinances, it takes about a year to get that effective. If we leave any addiction in the same way, it takes about a year to get effective. That how we are taking the preventive steps. What is even more important is that there are ways that there are exemptions also being made to the ordinances. For example, hookah, that is still allowed. In the same way, if we get past coffee, we probably are going to drink something else, which would be addictive, addictive component, adding to our daily life. So what is the takeaway? Takeaway is to put the prevention. However, it is also important to spread the awareness about the ordinances and education resources to schools and the kids.
The next speaker is Jade Chow. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. And Jade, I've asked to unmute the mic and you're ready to go.
Can you guys hear me?
Yeah, go ahead.
Perfect. Good afternoon, gentlemen, Mr. Smidian and Mr. Lee. My name is Jade Chow, and I am the immediate past president of the Palo Alto PTA Council. I have 2 kids who are 15 and 17 years old. They tell me that there are dedicated bathrooms next to the library that is a vaping bathroom. Kids are able to buy vape products easily in our town. This is not okay. I wonder how kids are able to get these vapes and jewels. So I went back to reread the Palo Alto Tobacco Retail License Ordinance on enforcement of flavored tobacco products. In section 4.64.160, subsection D, under enforcement, it clearly states that violation of this chapter may be remedied by a civil action brought by the city attorney or Santa Clara County Council. Each day on which the tobacco product is offered for sale in violation of this chapter, and each individual retail tobacco product that is sold or distributed in violation of this chapter shall constitute a separate violation. The penalties for retailing with a permit states in relevant part Section 4.64.130, subsections B1, B2, B3 reads, if a retailer or any of the retailer's agents or employees has violated any of the requirements, conditions, or prohibitions, the evidence shall be fined $100 for a first violation within a 12-month period, $200 for a second, and $500 for additional violations. Subsection C 1, 2, and 3 states the retailer's permit shall be suspended up to 30 days for a first violation, 90 days for a second violation, and for up to 1 year for each additional violation. I am asking you, no, actually I'm begging you, please, as a parent of teenagers, enforce this ordinance to help our kids not be able to casually buy vape products from the local tobacco shop. Thank you so much.
Next speaker is Trisha Barr. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Trisha Barr, and I'm the mom of 3 teen boys. I live in Menlo Park and am the co-chair of the San Mateo County Tobacco Education Coalition. Thank you, supervisors, for your work on this issue. Your ordinance is a strong one and is a model not only for the cities within Santa Clara County, but also for other cities and counties. I wasn't planning on speaking today, but I think it's important. First, I wanted to speak to Mike Rogers' point. The tobacco shop he's referring to, Max Smoke Shop, has quickly shifted their business model to also selling alcohol and seem to be doing fine as a going concern. Second, similar to an earlier speaker's experience, at the end of November, I went to the Raw Smoke Shop in Palo Alto as a potential customer. I asked for vapes and they provided me a price list of flavored puff bars, which they had out of view, but available. While I was there in the store, a boy came in with a list of items to purchase. The retailer took more prohibited tobacco products from behind the counter in a cabinet. He sold them to the boy without asking him for identification. When I questioned him on that, they said he was a regular customer and they didn't need to. Please review how to more effectively or frequently enforce the county policy that's already been adopted, or please consider tobacco license revocation upon the first violation, not the fourth. Also, if it's possible to consider an ordinance that also fines or revokes licenses for tobacco distributors for providing products to retailers in locations where it's prohibited, please explore that possibility. Distributors are providing product to retailers in places where they are not allowed to sell it. Thank you.
Next speaker is Latha Palanapian. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, supervisors. My name is Latha Palanipan. I'm a physician and professor at Stanford University School of Medicine. I am here representing the California chapter of the American College of Cardiology Prevention Committee, which represents the voice of more than 4,000 cardiovascular specialists, including cardiologists, advanced practice nurses, pharmacists, physician assistants, and other clinicians in the care teams of California. There are 42,000 members of the American College of Cardiology in the country. The American College of Cardiology supports the enforcement of measures to prevent the casual purchase of tobacco products by youth in Santa Clara County. We encourage the county to enforce the ordinance passed in 2019 to prohibit sale of flavored tobacco products in our community. Thank you to the Santa Clara County for taking the positive lead on this issue for the health of our nation. Thank you.
The next speaker is Varsha. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hello, my name is Varsha Ramachandran. I'm a high school student. I've been seeing vaping and smoking happen in my community, and it's really devastating to see children's lives being ruined. Smoking and flavored vaping in general are extremely devastating because of withdrawal. Once you take 1 or 2 vapes, you're hooked onto it for the rest of your life, and rehabbing is extremely difficult. What Psychological studies have shown that brighter, more flamboyant items are very appealing to youth, and vape companies are taking advantage of this. Other studies have shown that about 90% of children, their first smoking or vaping product was a flavored vape. In my own school, during my school dance, there were a very large group of students vaping outside of my school campus, and they were flavored vapes when I walked past and checked. The Santa Clara County of Health needs to do a better job of enforcing these laws in order to prevent the selling of these vapes, as it's really destroying children's lives and it's hooking them onto something that is bad for the environment and for their health. Thank you so much.
The next speaker is Candy Sornuis. I am unmuting you. Please accept the
Excuse
unmute.
me, Mr. Clark, before we go to our next speaker, how many more speakers do we have? I just want to be mindful of the time here.
We have 2 requests to speak in the queue.
All right, thank you very much. Go right ahead, next speaker. Sorry for the interruption.
Oh, no problem. Candy, please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Can you hear me now?
Yeah, go right ahead.
Okay. Good afternoon. My name is Candy Sarunas. I am a pharmacist and a professor of clinical pharmacy at UCSF Health and UCSF School of Pharmacy. I am also a Palo Alto resident and a parent of 2 teenage girls who are prime targets for tobacco-related marketing and advertising. I appreciate the county's efforts to address youth access to e-cigarettes via brick and mortar stores. However, a significant risk remains with online retailers. In 2019, I, along with my colleagues, published a study in the Journal of Tobacco Control centered around the warning letters that the FDA issued against online retailers who market and sell e-cigarettes. These violations were across the board, focused on a variety of issues. The first of which we noticed that the majority of these retailers were based in 3 states, with the majority being based in California. In addition, we noted that the majority of the violations were marketing to minors, and the products that they were marketing likened them to food and beverages that appeal to kids. I asked the committee to increase not only enforcement of regular brick and mortar stores, but online sales, working with our federal agents to find more effective ways of age gating and not allowing kids to enter any age to access e-cigarettes. In addition, we need to look at the non-nicotine containing liquids that serve as a gateway to nicotine containing e-cigarettes. And I also encourage the committee to support poison prevention packaging for these products to limit access to kids and children and pets. Thank you.
Our final speaker is Indira S. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, Supervisors Simitian and Lee. I'm Indira Selva Kumaraswamy, a mother to a middle schooler and a high schooler in Palo Alto. I'm an active member at both of my school's PTAs and currently the VP of Health and Wellness for the Palo Alto Council of PTAs. I'm here on behalf of all the parents whose children are hopelessly addicted to the vicious life-choking habit of vaping, and for those parents who, like me, are mortally terrified of our children falling prey to it and wasting their life, despite our best efforts to keep them safe. Peer pressure, as we are all well aware, is a very real phenomenon. Despite our best supervision, advice, and support, children tend to indulge in inappropriate activities for friendship and belonging. Vaping is one such activity. It is great that we worked hard to create a tobacco and e-cigarettes ordinance in Palo Alto, but of what use is it if it's not acted upon? It is very clearly illegal for anyone to sell tobacco and e-cigarettes such as vapes and jewels to any person under the age of 21 years. But yet, a child of 14 years can walk into any of the 5 vape shops in Palo Alto and buy vapes as though they are buying a bag of chips or an ice cream cone. We are the responsible adults in this equation, and let us do what is needed to protect our children. I implore you to start enforcing compliance on a regular and continuous basis to make the retailers aware of the harm that they are causing and the young lives they're taking by not following the law. I request you all to act with utmost urgency and save our children. Let us show them that we indeed are the trusted, caring adults they can depend on. Thank you for considering my request.
And that concludes our request to speak.
Thank you very much. Thank you to all who took time to participate in the hearing today. Let me ask that we go back to county staff. And Ms. Cox, let me just ask a couple more questions, if I may. I think you're still standing by, yes?
Yes, I'm here.
There you go. Thank you. It's forgive me, and if you need to phone a friend here, and I'm not being altogether flippant, feel free to say so, because what's complicating for action at our county level is the fact that we have 15 cities and towns, some of which have their own ordinances, some of which don't. The ordinances are not all identical, as I understand it. Some of which have shared responsibility for enforcement with our county, even within our county, as your chart makes plain. Thank you for that. We have some shared responsibility for enforcement even within the county organization. Most of the folks we heard from today are from Palo Alto, so let me just use that as a specific example to understand the challenge here. First of all, do you happen to remember? I know our own ordinance, if I'm remembering correctly, was passed, I want to say 2 years ago at the end of 2019. Am I remembering that right?
Yes, that's correct. Fall 2019.
And then the Palo Alto ordinance was adopted when?
The Palo Alto ordinance was adopted in August of 2020 and then became effective 30 days in September 2020.
Okay. And the reason I'm asking is it goes to this question of when we can reasonably expect that, there's been a period of time for people to become knowledgeable and aware. And what I hear you saying is that it's been, I'm counting on my fingers here, it's been 1.5 years now in Palo Alto that they've had an ordinance passed, yes?
Yes.
And I know from looking at our own, and forgive me if people thought I was impolite, I apologize. I was rifling through our own ordinance and looking at page 17 of 23 in the ordinance, section B11-588. No, it's not a pop quiz, I promise. But I was looking at the amount of fines for first, second, third violations that people were referencing, and then the suspension for up to 30 days, 90 days, or a year. I don't know, in the Palo Alto case, our ordinance says $100 fine may be imposed within 12 months, for first violation within a 12-month period, then up to 200 for a second violation, 500 for the additional violation. Then permit suspensions are authorized for first, second, third violations for 30 days, 90 days, or a year. And that's within any 60-month period. Do you know if that's the same for Palo Alto?
It is the same.
So in a minute, I'm going to ask you about this fragmented enforcement, which you may tell me is not fragmented, but to me, it kind of looks like it's a little hard to know who's really supposed to be on top of this stuff. But, 1.5 years in, 2+ years since we adopted our own ordinance, as I'm hearing from folks and looking at the document here, it does seem to me that now that people know the ordinance is on the books, saying that you can violate the ordinance, repeatedly without facing what I would call a really significant suspension, by which I mean up to a year, it sort of gives people the notion that it is a cost of doing business. Do you have any, that you can just say, well, sure, we can go ahead and get away with that because we'll get a fine. It's a modest amount given the context of our operation, and the chances of a suspension are relatively modest given the fact that you can get, up to 3 before you get to a really significant number. Thoughts?
Yeah, so I think in the cases that were raised today by many of the commenters, particular business that has continued to violate, we do take that very seriously and have moved forward, in fact, with a recommended suspension based on the number of violations that we have received information on. So up to 90 days. And then if there is a second violation, I think this is where it's important and contingent upon us to really be focused on doing additional inspections to check compliance after the penalty is issued. Because then they're really, 90 days, if you're a tobacco or vape shop, is fairly significant if, you can't operate your business. And then if there is a second violation, you can lose your permit for up to an entire year. And we increased the look back period to 60 months, taking that into account that for those really serious violations of, the things that were raised today about continuing to sell products that are illegal under the ordinance, as well as selling to a minor, which we do take really seriously. And in those instances, we do move forward with issuing these stiffer penalties.
Well, so let's go to this issue of I'm looking at the chart again on page 2 of the report that has Dr. Cody's name on it, but that I am guessing you were very much involved in helping to prepare. Page 2 of 8, packet page 71, agency responsible for activity under each TRP and tobacco retail permit. And there's the county, Cupertino, Los Gatos, Palo Alto. And, depending on what I'm looking at, it could be the public health department, it could be our county department of environmental health, or it could be the Palo Alto Police Department. And so I'm just, because this is not something I deal with on a day-to-day basis, the way many of the advocates do and the way you certainly do. I'm sitting here saying to myself, all right, if we have a store, a retailer, who is violating a local ordinance in Palo Alto by selling a product which is flat out prohibited. So there's no question about age, which is why I was asking you those questions at the outset. That seems to me to be pretty straightforward. Like if you can't sell vaping supplies, you can't sell vaping supplies. If you can't sell flavored tobacco, you can't sell flavored tobacco. So a year and a half in, what do you hear as the quote excuses when you talk to these folks? Let's start there.
So typically when our Department of Environmental Health goes out to do annual inspections, and in all of the cases, annually they do these checks. When they have gone out, they have actually found almost no violations of continuing to sell flavored products or vaping products. When they do come across a store that has sold, needs additional education, didn't know it didn't apply, that sort of thing. The education is provided, the notice is provided, then, that they need to comply with the ordinance. And then it's almost always corrected on site. I think what many of the speakers talked about was this one instance of which we found in doing some additional follow-up of one business that was doing things a little bit more under the table in terms of not displaying the products that, when we go out and look at the store are displayed on shelves and that sort of thing. So I think just from a high level standpoint, we do see most of these businesses really complying with the regulations. We provide, tons of education in person and information and fact sheets to make sure that the businesses are properly noticed prior to the changes going into effect. And by and large, really do find that most businesses are compliant upon these visits. And so I think it's just, these very minimal number of cases that we're finding at this point, really just one where there's these kind of repeated non-compliance.
Okay. When environmental health folks go for an inspection, do they look only at what is openly displayed as opposed to, asking to see inside a locked cabinet or a closet or a box or whatever? What's the nature and extent? I'm sure there's a balance in terms of thorough versus inappropriately intrusive. What's that look like?
Yeah, so typically that they ask the owner or the clerk there to show them what products are being sold and to kind of go through their inspection checklist. And I might defer to county council on the other parts of the protocol. There is some limitations on what they can and can't inspect. But typically they go in and ask the retailer to show the tobacco products that they have for sale. Typically, if you're familiar with many of these stores, they're big display behind the counter, although increasingly smaller display, and look at what the businesses have out and on the shelves.
In the Palo Alto instance, and I'm looking again at the grid here that you were kind enough to prepare. Is it environmental health who is there to inspect whether vaping products or flavored tobacco is sold at all? I mean, again, this is not a question of failing to monitor somebody's ID for minors. That's why I asked the question about flat out prohibition. So does that mean that they are simply, it's environmental health who's going to do those inspections?
Yes, that's correct.
All right. And do we have anybody in the meeting today with you to be your backstop from environmental health?
I don't, but I'd be happy to, consult and follow up, on any questions that I can't respond to.
I'm going to give you one that maybe you can't respond to, and if you can, I'll be delighted. I think one of the things when you have multiple agencies responsible for enforcement is folks in the public understandably get frustrated when people are pointing in different directions in terms of whose responsibility it is to enforce something. So if there is a problem, who's supposed to be the party that cracks down on this in Palo Alto? Is it the Palo Alto Police Department, or is it the Department of Environmental Health, or is it the Public Health Department?
Yeah, so the Environmental Health Department is responsible for issuing penalties that are resulting from a violation of the county ordinance, as well as the City of Palo Alto ordinance, because we have a formal agreement with the city to monitor the program. So it really is environmental health that issues those violations. However, I just want to say, as you noted, it does require cooperation with other local agencies, like, for example, the Palo Alto Police Department, who plays a role and needs to provide the county with information. So there is that dynamic.
Are you at liberty to say, in connection with the one smoke shop that was referenced, Raw, what their status is?
Yes, I am able to share that they were issued a notice of violation with a recommended suspension of 90 days for violating 2 sections of the county ordinance.
And when did that happen?
Sorry, sections of the Palo Alto City ordinance.
And when did that happen?
That notice went out today.
Okay, and that is from Environmental Health?
That's correct.
And you said with a recommendation, the recommendation is to whom?
To the business owner.
And just help me understand the terms of art here. Does that mean, dear sir or madam, you have been suspended for 90 days? Or is that the word recommendation is what's throwing me off?
The reason it's stated as a recommendation is because there is an appeals process as part of the ordinance process. And so that is the recommendation that has been put forward by Environmental Health. And the process will need to play out through the appeals process.
So effectively what's happened is the Environmental Health Office has sent a notice to this particular retailer. Hey, based on our observations, you've got a second violation within a 60-month period, and therefore a 90-day suspension is warranted. And the reason it's called a recommendation is because they could always appeal that. And if they appeal it, does that go to our county hearing officer? Is that where it goes?
Yes, it does.
And do we know if that process has been, have we had appeals going to our county hearing officer in the last couple of years?
We have had, I believe we've had two cases.
And are the recommendations sustained in your observation and experience, or do you recall?
You know, I'd have to get back to you. I don't want to, I can't say for certain.
Okay. So again, I see the Palo Alto Police Department listed here only with reference to sales to minors. Is that the limited area where we anticipate they'll be the enforcement entity?
Yes, that's correct.
Okay, thank you. That answers some of my questions. Let me see what Supervisor Lee, who's very patiently had his hand up for the last 15 minutes. So thank you, Supervisor Lee. And thank you, Ms. Cox. Let's go to Supervisor Lee for his questions and comments.
Yeah, thank you, Chair. The ordinance fine of like $100 or $200 in the Silicon Valley seemed to be ridiculously low, and frankly has no teeth or deterrent effect, in my opinion. On page 3 of the opinion, said that 6 stores were caught selling tobacco products to underage children. How much were they fined, and if any of these have actually got the license suspended?
Yeah, so we recently obtained that documentation from the County Sheriff's Office, and our Environmental Health Department is working on the recommended enforcement actions as related to those violations. But those are violations of the ordinance that we take very seriously. And in each case where that has, where that violation has occurred, there are suspensions recommended as part of those actions. And as noted, they're graduated. So if it's a second violation, we're looking at a 90-day suspension. If it's a third violation, suspension of up to a year is recommended. So depending on, which violation they might be at.
Right. So for the past year, let's say, how many have received this type of a letter of about getting their license suspended?
I would need to consult with environmental health to give you the firm answer on that.
Yeah, you can give it back to the health agenda in the future. I really appreciate it. When it comes to these type of inspections, shall we say, right? Do they get to search for these contraband? And if they know that these are completely prohibited products, in other words, you can sell to 18-year-olds or more, are they subject to instant confiscation from the store?
If the store is found selling products that they shouldn't be?
Correct. If they found them, I mean, they were being inspected, they got caught, that they have those products under the table or behind the counter, do the inspector then at that point go ahead and confiscate these products, or they just leave it there?
Typically, they instruct the retailer, the owner, that they need to return the products and get rid of them. I know that this is a limitation of current enforcement, and it would be something we would need to consult with Environmental Health and County Council on whether there's more we could be doing related to that issue.
Yeah, definitely. And then in your report, you actually mentioned that the Department of Public Health is intending to bring back any recommendation to improve our ability to enforce the ordinance in the future and to strengthen the existing tobacco control ordinance in a later date. So I would say these are information that I would like to hear from you working through county councils, how we could really add some teeth to the inspection process so that they don't get to keep what's there. But they found they're holding these type of contrabands. They need to have the power to confiscate, clearly. Let's see. So in your report, it mentions that more than 22% of the teens are buying directly from the local stores, with about like a quarter or more of the youth reporting that those age weren't verified. I guess at the end of the day is, what can we do on the inspection front to end this facade of prohibition when these rules are so openly flaunted by, close to a quarter of the stores, right?
Yeah, I think Supervisor Lee, that is precisely, I think, why the county has taken the approach to prohibit the products that we know are marketed and used by youth in the county. So I think the county is really doing quite a lot to address this issue, given we know from these surveys that youth are, reporting they're able to get products from local stores. And so I think continuing to fully implement the county's ordinance, continuing to monitor if there are loopholes that need to be addressed, either from something the industry might be doing or something that we might be able to do in strengthening, our local ordinance efforts. So I think we are, we're doing a lot, but constantly, we're always needing to evaluate how things are working.
Okay. Now, there are deliveries also being done by these vape shops and dealers, right? And the kids, they say like a third of them talk about getting direct deliveries from these shops. How do you conduct the oversight for the vape delivery service?
Yeah, so I don't know if County Council might want to respond to this too, but currently our oversight for the county ordinance only applies to brick and mortar stores. So store at the site, at the location of the store. I can't really speak to whether, we would have authority around deliveries. I certainly think that could be something, we would discuss with County Council, given some of the national surveys we've seen during the pandemic where more stores were providing that direct delivery, which is not something we had seen as much in the past. We've seen that more from the manufacturers of many of these products, in which, federally there's been more protections and put into place, and also at the state level. But I see, I don't know if Michael might want to say something.
Mr. Rossi, from County Counsel's office, would you like to comment briefly in response to the issues raised by Supervisor Lee?
Right, I was just going to, and thank you, Chairperson Simitian. I was, and Supervisor Lee, I was just going to agree with Ms. Cox that we don't currently have the ability to enforce against delivery services as we didn't anticipate it in the ordinance. It seems to be sort of a recent development in the delivery of these products, but certainly something that we can and should look at for future ordinance updates.
Yeah, since the start of the pandemic, as we all know, that food delivery like DoorDash and Uber Eats, right, those have become extremely popular. So if it's such a hard time to check my ID and all that to buy in the shops, why don't have them delivered to my door? That's even easier, right? So I certainly think that there's a gaping hole here in terms of that type of enforcement. So I think in the next round, when you come in with a recommendation, please make sure to look at this oversight issue regarding delivery service. There's also a report this report also states that more than half of the youth that use e-cigarettes reported it was actually easier to get e-cigarettes since the pandemic has started. But nationally, this actually has been down, right? So if our county seems to be, are we doing a worse job than the rest of the country? Or was it because we just don't have enough teeth to strengthen the barriers that we're talking about?
So our county is actually doing better off on many of these issues than the rest of the country, and even in the state. We're always competing with County of Marin and San Mateo County for the lowest youth and adult smoking rate, but we are actually doing much better in terms of addressing these particular issues. And I think it's in large part due to the local regulations that the county has, led on, and we continue to work with all of our cities to promote as well. So I think it's just, a matter of monitoring how they're working. Great.
Now, the inspector we talked about really are going after the stores doing the illegal sales. One speaker mentioned that there are these vaping bathrooms where kids hang out to go vape their, to share their vapes and whatnot, right? Do we have any type of enforcement inspection to confiscate these types of illegally obtained vaping products from the minors?
So we aren't currently set up to do that kind of enforcement or inspection of basically enforcing possession of products. That's actually a strategy that we have moved away from, particularly because, well, a couple reasons. One, it wasn't really a proven effective strategy to really prevent youth use of products. Many health agencies began to oppose those measures. Additionally, through evaluation of that type of enforcement, it was found that it was often applied differently to different people and was leading to more sort of over policing of young people and actually youth, being fined like misdemeanors for this kind of infraction. And so that's something that we have shied away from. However, we do work really closely with the County Office of Education. They have a tobacco use prevention education enforcement program. They're working closely with schools and getting schools funding for things like vape detector devices and doing more education around with parents and youth and also creating alternatives to suspension at schools, providing different types of intervention activities for young people.
Yeah, no, I have no interest of criminalizing for their possession per se or the use. I think my question here is really more about what we can do to just secession. And also, after they are minors, so certainly contacting the parents is something that we can do. And then the last question I have is regarding this age gating that I was talking about. And that is, what type of enforcement can we do to go after online retailers that are targeting minors into our county? I think that's a much more difficult topic because obviously they're using a mail system, a FedEx, whatever, to get these things to us. Is there a role that we could play in order to discourage those at least advertisements into our kids at their home on their phones?
Yeah, thank you, Vice Chairperson Lee. I think that's another question that we can work with County Council to evaluate what type of role or options there might be for regulation, and maybe Michael Rossi might have more to say now.
Mr. Rossi, go right ahead.
Thank you. So I believe that taking a good hard look at the retailers who deliver the products to the local shops would be a good next step in enforcement as we see an increase in these types of retail businesses. They're not getting the products out of thin air. There is somebody that is selling them to them, perhaps knowing of their illegality in our jurisdiction. And that's certainly a subject for further investigation and brainstorming on how we can effectively enforce against that.
Thank you. Supervisor Lee, does that wrap your questions? I have one more and then
that's all I have. Thank you, Chair.
Thank you. Suggested direction that I'll try and pull Supervisor Lee into, and I know he'll lower his hand in a moment. But going back to Ms. Cox, if I were to say, I want to make sure I heard you right. I think I did. I thought what I heard you say is, actually we get pretty good compliance from most folks, but there's always a bad actor or two out there who is a source of significant concern. Those are my words, but do they fairly reflect your communication to us today?
Yeah, I think that's accurate. That it is, very infrequent that we see that type of clear violation of the policy.
So I guess my question to you would be, do you have a thought about whether that kind of persistent violation is a function of insufficient fines, lack of ability to enforce more rigorously, or both, or neither, something else?
I'm not sure. I think it will, it's something we want to evaluate as we move forward with issuing these violations and, hopefully seeing them upheld, and then to continue to monitor to see whether that has been a deterrent. I think the type of thing we've seen in this case is very, very new. It's not something we've seen before. And so I think it's hard to say exactly what will be a bigger deterrent.
When, if at all, is there a anticipated return to our board with suggested updates to the ordinance?
Good question. I think we would probably need, you know, a few months. I feel one of our next steps is to roll out doing inspections of all the 71 retailers that we oversee in the county and get a, you know, good understanding of how widespread this issue is, and then, you know, need some time to work with county council on the recommendations that were suggested today. So,
well, here's where I'm headed, and you know, push back if you need to, but I'm mindful of the fact that it has been 2 years since we took action on our ordinance. Year and a half in the Palo Alto case, and I'm guessing sort of the same range for some of these other communities. Yes.
Yes.
And so we're at a place now where I think, you know, the time is right to say, all right, how'd we do? What worked? What didn't? What makes sense in terms of possible changes? I've hinted at some. Supervisor Lee, I think, has been a little more specific. What if I said, could we ask Department of Environmental Health, Public Health, and County Council to come back with a recommended package at our April committee meeting? Is that doable? And the reason I'm asking is because then after that, we would want to get it to the full board, which is where an ordinance has to go, as you know. And that would probably mean May. And then that would mean we could take some action before we go into the July recess, which just by chance this year is structured as a relatively lengthy recess. So I worry we'd be looking at August, September, even before we could take any action if we don't move relatively soon. Does that give you enough time?
I think we could make it work in April. I think May would give us a little more time to do a little more, you know, research and evaluation on the many things that were raised today. So I think our preference would be no sooner than May.
All right, I'm looking at my calendar, forgive me, and we have a Health and Hospital Committee meeting scheduled in mid-May. That may be subject to change. So I'm gonna be a little vague on purpose, but why don't we ask you to come back to our HHC? I'm gonna ask Supervisor Lee, since he was halfway into a motion just a few minutes ago. Anyway, I want to respect that, to simply ask you to come back with all three of those entities, so everybody's on the same page, if we can be, with any recommendations for an update. And I won't, you know, prejudge what that should or shouldn't include. We'll ask all three of you to weigh in on that. But it should consider and address any of the issues that were raised today, which I think you can go back and watch the meeting a second time if it wasn't, you know, enough to see it once. And then I think if we acted relatively expeditiously, we could probably still take action in the month of June as a full board if things moved along relatively quickly. Okay. So Supervisor Lee, can I get a motion to that effect?
Yes, a motion to that. Actually, I do have a suggestion as well.
Go to it.
I think the issue is enforcement. Annual inspection is nice, but I think some of these might actually need a little bit more. So I would certainly ask staff to consider going out there and see what else you're looking at in terms of these type of violations. You identified there were 6, but I'm just wondering there actually might be a lot more that is not being reviewed, given the testimony we've heard from many of the parents that is facing these issues day to day. So I would like to ask that when you come back in May for this report, to see if you could also gather some more information regarding the additional inspections to see will we actually have more issues and more about these suspension notices being sent out. Okay, thank you. And that's my motion.
I'm going to take that as a motion from Supervisor Lee, which I'm going to second. Mm-hmm. And unless there's additional comment or question by staff, we have heard from the public, and I can ask the clerk to call the roll. Ms. Ms. Cox, Mr. Rossi, anybody else on the staff want to weigh in or in the county counsel's office?
Nothing more for me.
Thank you, ma'am, and thank you for the work you and your team do. And before we call a roll, I'll just say I just think, and you were tactful about it, Ms. Cox, but I just say, whatever your views on these issues are, and I know that there are people who have a range of views. Once we've got a law in the books, it's got to be enforced, and folks have to follow the law. And I think, again, some folks will be more tolerant or empathetic or sympathetic to a first violation, but when we're talking about folks who just repeatedly and consistently flout the law, I think we have to have a system in place, whether it's the ordinance language or the system of enforcement, that means it's real. So call the roll, Mr. Clerk. Motion by Lee, second by Simidian.
Vice Chairperson Lee.
Lee, aye.
And Chairperson Simidian.
Aye, and we will see you all in May. Thank you very much. All right. Thank you all for your patience. I know we're running a little long today. We had quite a bit of public comment earlier today, but that leaves us with item number 10 because we took up item number 11 as a time certain. And let me go to item number 10 next. And Mr. Santiago, if you are still with us, and I think you are, there you are. Would you walk us through this, please?
No, yes, absolutely. And good evening, Chair Simidian and Supervisor Lee. I submitted and apologize for a late report yesterday. Gives you the latest as far as we know related to CalAIM. And there was some discussion before related to some of these initiatives. As you know, one of the complicating factors here is there are so many different initiatives that overlap some of the budget proposals by the governor as well. So we have established a tracking and monitoring system to make sure that we identify there's almost more than 70 different projects and initiatives as part of CalAIM that we have a tracking and monitoring system so that in fact we're able to not just maximize the revenue for our county, but most importantly, provide the services and the care and improve the outcomes for our residents. The second piece that I wanted to highlight in my report is I give you a little bit of a snapshot in terms of the recently released RFP. This is a procurement, a continuing topic that you've had related to the private option that's available here as part of the two-plan model for Medi-Cal managed care. And as you know, it's CalAIM. Managed care plans play a more increasingly larger and more important role for our county and our safety net. So the state has released the RFP February 9th. Proponents are supposed to respond by the deadline of April 11th of this year. The state intends to award, or at least announce the awardees in August of this year, 2022. And again, this would be for an effective date of the private option for January 2024. So that will give you a little bit of an update, and we have the links there in terms of where you can find more information. The other piece that I wanted to highlight for you was the SB 855, given the critical importance of mental health and substance abuse in our community. It's a top priority for us and your board. So one of the things that we indicate there is this is a bill that was signed by the governor. We sponsored last year. It was signed in the fall of 2021 and essentially establishes two critical things. One of them, it reaffirms and clarifies the California parity law that mental health and substance abuse services should be at the same level of comparability related to the medical part of the house in terms of benefits. And then secondly, the most important part is that it indicates a series of penalties and consequences of insurers failing to provide parity in terms of benefits that go beyond just a short and acute care hospitalization, which has been traditionally the very limited benefit that's available through the private insured populations. This is so important. The legislation indicates, makes it very explicit that it's intended to clarify that it's not the responsibility of county or state Medi-Cal programs for the failings of the private insurance companies. And I know this has been a big issue for us here locally, where many of our residents have, as you know, expressed grievances and complaints related to their limited access to behavioral health services through the private insurance, and they're seeking help and assistance to our county for delivery of that care. So that gives you some links and some additional information. I know there's a workshop coming up in terms of behavioral health and our roles and responsibilities, but we wanted to make sure that you had that information as background. So in the interest of time, I'll stop there, and unless you have any questions for me, and
I will just ask before I turn to Supervisor Lee, and we will make our way through the 10A through H here and then take public comment at the end. But on your report, Mr. Santiago, I will just ask that on the SB 855 issues about parity, mental health coverage, that please be sure that we do hear a little bit more about that when we have the workshop that's coming up. And then on the dual plan that you described in terms of Medi-Cal and a private provider, and forgive me if it's in the report, as I mentioned, I haven't had a chance to get to it yet, but did the state end up taking any action on the possibility of a special relationship with Kaiser? And if so, what came of that, and what's it mean for us?
Yes, related to the Kaiser deal, which is, as you know, this is the direct contract that the governor had negotiated with Kaiser. And it's intended, again, to do several things, but allow Kaiser not necessarily to bid as a private option in counties, but essentially assures them participation in Medi-Cal. Many of Kaiser, including in our county here, they're a subcontractor to the public plan, which in this case is family health plan. So in this particular case, it becomes a third option in our county. It is an effective date of January 2024. However, the governor is proposing to clarify his authority through a trailer bill language to make sure that it has sunshine, I guess, in front of the legislation. And they're supposed to be scheduling some hearings as part of the budget deliberation at the state of California. That trailer bill language has been released. We shared it with county council as well as our teams so that they can begin to review and what may or implications may have for us here locally. So I know that Dr. Smith is obviously very interested in this particular case, and I know we're working with him so that we're fully prepared for a full report at a future board date related to that deal.
All right. And Mr. Santiago, you made passing reference to how complex just the Cal AIM piece is. I often share with folks that one of the challenges of healthcare policy is that it's not only big and sprawling and complex in and of itself, but that it is ever changing. And so just sort of staying on top of that change, I'm going to tease Mr. Margolan and say it's what keeps him in work, is part of the challenge. But if I understood you correctly, as things now stand, we have a two-plan system right now in 2022. The private provider could change in 2023, which would be based on whoever wins the bid. And then we could have a third entry as early as 2024.
Well, the third entry and the new private would be, if it's a new private, would be all effective January 2024. Both of them will be effective at the same date.
But we'll know who the new private is in 2023, yes?
Well, the state has outlined that we would know later on this year, this calendar year. So
yeah,
it will be in August 22.
Yeah, I just think, it's a mixed blessing, I guess, to know sooner rather than later, but it just means to me, we're going to have to start working with that new provider end of this year, beginning of next. And then, we're going to have for real, if the Kaiser deal stays in place, yet a third player who will be new to the scene. That's just a lot to manage, and I, wish us all well, and you in particular. So, Supervisor Lee, anything else on just 10A before we go on to the other items?
Nothing from me, thank you.
10B is the report from the health officer. We spoke with the health officer at length on the COVID issues, of course. I'm good there. Anything else for you, Supervisor Lee?
I'm good, thank you.
And 10C, Mr. Lorenz, I had a couple of items that were agendized where we chatted with Mr. Lorenz. Any questions from you, Supervisor Lee?
No.
All right. Item number 10D, behavioral health services. Mr. Rao, are you still with us? I know it's been a long day for you. Thanks so much.
Supervisor.
Mr. Rao, given the hour and the complexity and importance, I know that that we're having some issues around the Alcove program and site in San Jose. To my knowledge, those issues are not affecting the Palo Alto operation. Am I right about that so far, or is there something else I should know?
No, that's correct, Supervisor.
Okay, thank you. I think you know how important the program is. I don't have to, you work to make it happen for, all those years, so I don't have to make that case with you. I do think we got to figure out what the facilities issue is and the delivery system mean. And I think probably the best way, given the hour, is to say, why don't we pull you and Dr. Smith and appropriate members of the board and respective staffs into a conversation with the folks at Alcove and figure out how we can manage those issues and still have an Alcove program that remains true to the Alcove model. Is that something we can do in advance of having the regularly scheduled report back in March? Does that work for you and your team?
Yes, that will work for us, Supervisor.
All right. Well, I think my goal in sunshining that now is so that we don't start the conversation in a public way come March. I'm hoping that by March we say, here's our bundle of solutions that's going to let us go forward in the best possible way. Okay?
Okay, will do. Thank you.
And again, we may have speakers on any or all of these items at the end. We'll ask when we get through 10H. 10E is the CEO from the Valley Health. Oh, excuse me, Supervisor Lee, I raced right by. No questions. Just wanted to check. 10E, Valley Health Plan. I have no questions. Ms. Rosas, anything you want to share real quick?
Just our PCAP numbers are doing really well. We're at over 9,300, and we're seeing a nice uptick in the 200 to 400% new eligibility bracket, about 179 new people during the last few weeks. So we're really ramping up our outreach and excited to keep on working on expanding the program.
Thank you. I had a question, but you answered it in anticipation. I was going to ask about that missing middle as I described the group that you just described.
It's actually 197. I transposed my numbers, 197, right. Nearly 200.
All right. Thank you. Supervisor Lee, anything for Valley Health Plan? Then let's go on to EMS. See if anybody there has anything they want to share today. I have no questions.
No. Good.
All right. Miller, we'll let you take a breather this time around. Supervisor Lee, you okay with that? Okay, thank you, Dr. Miller, as well. Custody health. Ms. Day, anything you want to share?
Supervisor, just to let you know that Omicron, our case rates have come down with our patients to 44 patients, 39 at Elmwood and 5 at Main Jail. Our vaccination incentive program is working. To date, we have 1,665 patients that are fully vaccinated. And of those, 763 are also boosted. So that's the end of my report.
All right. And let me turn to Supervisor Lee, but let me just say, Dr. Day should have, with all the degrees I know you have, I should have used the title. So
You're fine.
no, that's you worked hard for him, I know. So let me turn to Supervisor Lee and see if he has any questions.
No questions.
All right. Thanks, Dr. Day. You have a challenging job and appreciate it.
Thank you.
All right. And then that will take us to 10H, which is the report on federal health policy and budget landscape. And are we turning to, here he is, Mr. Margolis.
Here.
All right.
I just have three quick points to make. The first is that the government's been operating under a CR, a continuing resolution now for several months. And it's likely that on March 11th, when the current CR expires, that rather than do another one, the federal government may actually get a budget package together, an omnibus budget package together. One of the implications of that is that the earmarks that have been advanced over the last several months, so-called congressionally directed funding, may actually become law as a result of having appropriations bills signed by the president. Second point I would make is that I talked last month about how Build Back Better might be revived with the president's State of the Union address on March 1st being a target deadline. Obviously, things have not moved in that direction. Build Back Better is largely discredited now. Very little is being done to negotiate that framework, but it is possible that when the president speaks next week, we'll see some revival of elements of Build Back Better, maybe with new packaging and new name. And the reason why I think it's possible we'll see that is we still have this reconciliation vehicle, the 51 vote vehicle that the Democrats can use to advance their initiatives. And it's hard for me to imagine the president won't attempt with the Democrats in the Senate and the House to get some of that Build Back Better package advanced. And then the third point, final point, is I've talked in the past about how there's one bipartisan effort in the Senate involving healthcare that's been moving along for months now. Senators Murray and Burr working on a pandemic preparedness reform, and they've actually now unveiled some of the high-level elements of that reform. It's called the Prevent Pandemics Act. It's a complex, multifaceted proposal to essentially reorient the CDC and the Health and Human Services Agency towards dealing with future pandemic threats, providing them with new authorities, giving them new mandates. And I'm prepared to report on in more detail on that package at a future meeting once it's more fully fleshed out. Those are my three brief points. Happy to respond to any questions you might have.
Let me see if Supervisor Lee has any questions.
So I guess the Build Back Better is pretty much on hold at this point. That sums it up.
Yeah, I think the title may be dead. Some of the elements may resurface next week, but I think that the title itself, the concept of Build Back Better, unfortunately appears to be off the table.
Mr. Margolis, a friend of mine from Washington, D.C. has started saying that they're looking forward to something smaller soon instead of Build Back Better. Now, whether that gets any traction or not, I will wait and see. But I thought, okay, that's a pretty dark view. All right. Excuse me, Supervisor Lee. I just was piggybacking on your question and Mr. Margolis' response. Anything else?
So one of the issues that was very big on this big omnibus bill was about the 2 year of preschools funded nationally. It seems like this is the one that was mentioned earlier that even Senator Manchin is supportive of. Do you see that potentially could be a standalone bill to pass the House and the Senate eventually?
Not as a standalone bill, because there's still a problem getting the 60 votes for it. But I do think if there's a revised 51 vote reconciliation package, absolutely, with Senator Manchin's support, we could see universal pre-K in that package. Absolutely, it's a possibility.
Okay, thank you very much.
You're welcome.
All right, and Mr. Margolis, I have no other comments or questions, so I will simply say thank you, and that wraps up item 10, but we do want to ask if there are speakers, Mr. Clerk, on item 10, and then
yes,
after we take those speakers, I want to make sure we remember the commitment I made earlier to hear anyone who stayed with us through the full meeting who wanted to speak on item number 6. So let's start with item number 10. How many speakers do we have, sir?
We have one request to speak.
All right, and let's hear from that person and give them up to 2 minutes.
All right, next speaker is Urvish Kumar Mehta. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much to Board of Supervisor, Chairperson, Vice Chairperson. I want to specifically mention about when we are referring to the reports. What becomes more effective in terms of that if we have any specific with regards to the COVID-19, understandably it is, that, there are measures, that we are taking. We have a dashboard, statistics, reports, coming up. However, what becomes more important is that, when we have a standards, benchmarks set against other comparative counties, what they are, the steps, they are taking, and what Santa Clara County has achieved as an accomplishment, that sets the threshold for the Santa Clara County. Certainly, verbal report does make a lot of difference in a sense. However, it would be important to set, making sure about that the new facilities, accepting the patients, accepting the visitors, number of improvements that has been made, enhancement, the special facility equipments that is being brought, number of patients being served, and what specific specification of cured that has been provided versus the regular patients and the outpatients from the regulatory body. That helps within the as a part of our public reports. And also, if you have any ordinance that has been established, it is also important to measure that how the effectiveness of ordinances are being implemented as well. Implementation is the one part, execution is second, but the effectiveness and the delivery and the setting the performance and the delivery for that is another concept altogether. So my request is the Board of Supervisors to consider along with the verbal report, to consider the performance report as well. Thank you very much, sir. Appreciate that.
All right. Any other speakers on item 10?
No request to speak.
All right. And then I think what I'll do is simply ask Supervisor Lee for a quick motion to receive the report on item 10, consistent with our published agenda.
So moved.
And I will second, and we'll call the roll on that one quickly.
Vice Chairperson Lee.
Aye.
And Chairperson Simitian.
Aye. And that leaves us with item number 6, and we've taken action to receive that report, but I did assure folks that if they wanted to stick around and share their observations with Supervisor Lee and me, we would accommodate that. Is there anyone, Mr. Clerk, still with us who wants to speak on item number 6?
There are no requests to speak.
All right, let's give folks just one more moment just in case they stepped away, missed it. I know it was a bit of a moving target.
We do have 2 requests to speak.
All right, let's go ahead and make sure we let those 2 folks speak, and let's give them the same minute and a half we gave earlier speakers, please.
Next speaker is Kai Y. I'm unmuting you. Please.
Did we hear from Kai earlier today on item 6?
For item number 6, let me go through my list here. Yes, Kai Y did speak on item 6.
All right, I'm going to ask folks not to speak twice on the same item. That's inconsistent with our rules of the board. And who's our second speaker?
Karen, I also have her speaking on item 6 already.
All right.
And
I'm going to go ahead and allow it just because I don't think I was clear about that earlier, and I want to err on the side of including comment. But Mr. Clerk, if you can help keep me clear about that, if we get into the same bind in the future, I'd appreciate it. But that's on me as the chair to make sure that I make it very plain that we're only talking about additional speakers who have not spoken previously. But let's go ahead and give these 2 folks an extra minute and a half since they stuck around through the whole meeting and I wasn't altogether clear on that. Go right ahead.
We had another speaker, Anthony Romero, as well. So there would be 3 speakers total.
Go ahead.
All right, Kai, I'll go back to you. You have 90 seconds to speak. The timer will begin when you start speaking.
Okay, yeah, so just this is about COVID, right? I think, right? And so just wanted to reiterate the stats. It's not even 1%. And like I said before, like it's you guys are learning as there's mutations and stuff like that, and we don't know what's coming. But it's not an emergency. It's not, and it doesn't, there's so much damage to, as you guys well know, what happens to kids amongst businesses and all that. Like, you know, it's not an emergency, so give us back our freedom.
The next speaker is Karen. I'm unmuting you. Please accept the unmute. You'll have 90 seconds to speak. The timer will start when you begin speaking.
Yes, hello. I'll only take about 30 seconds. First of all, I'm a little bit disappointed that every other speaker for every other topic got 2 minutes, but our topic only got 1:30. I was cut off when I mentioned the myocarditis post-vaccination at Monte Vista Christian School. There were 4 cases of it, which translates to somewhere in between 1 in 50 to 1 in 100 kids getting myocarditis post-vaccination. Please look into this. This is very serious. And also look into the CDC Foundation. They take money from Big Pharma, okay? So CDC is not unbiased. You can't just go by whatever they say. Please do your research. Thank you.
And our last speaker is Anthony Romero. I'm unmuting you. Please accept the unmute. You'll have 90 seconds to speak. The timer will start when you begin speaking.
Good evening. Good evening, gentlemen. Can you hear me?
Yeah, go ahead.
Okay, so real quick, just like everyone else has said, I think that there's plenty of evidence to provide, and not just people on, commentary, but Vanden Bosch, who was formerly with the Bill Gates Foundation, even he suggests that that these vaccines are turning recipients into shredding the viruses and making it worse on everybody else. You have the former head of the CDC against the vaccines, against the mandates. I mean, you can go on and on. And then just the hypocrisy. You have Susan Lewinsky or Lewinsky, whatever her name is. She cannot even give a straight answer when you ask her how many people died from COVID or died with COVID, or even on the topic of who in the CDC is actually vaccinated. It's laughable to hear you guys you mentioned yourself, Joseph, that with this tobacco that you guys just repeatedly let people break this ordinance over and over and over again. But the second it comes to COVID, it's a zero tolerance policy. I think that shows exactly where your bias is. And I think that that's unfair because you're not letting other people speak. Everyone that it sucks that everyone that I talked to didn't get a chance to show up today, and that many people showed up for tobacco. You guys need to understand, I'm speaking for hundreds of people. And even my daughter who goes to, she's trying to learn how to speak Spanish. How can she do that when the teacher is wearing a mask? You need, and even in this area, people who have English as a second language, how can they learn English when you can't even watch people pronunciate the words? Please do your research. That is your job, to do your research and to look out for the people. Thank you for your time. Have a good evening.
And we had a late request. Are we still accepting public comment now?
We're going to make this the last one, though, please.
All right. The last speaker is David Montiel. I'm unmuting you. Please accept the unmute. You'll have 90 seconds to speak. The timer will start when you begin speaking.
Hi, can you hear me?
Yeah, go right ahead.
Okay, so I'll get closer. There we go. I agree with the people that have been talking here about the COVID situation and everything, because what's going on is that I see not a transparency. What I mean by that is in the Santa Clara County Board of Supervisors and with Dr. Sarah Cody and everybody that in that COVID, dealing with COVID and everything else. What I mean is my transparency is you guys have not had open dialogue to have like open meetings, even outside. Why? Why can't you guys have outside meetings? I've been pushing for this for 2 years, just at least to have an outside meeting where you guys can face the public and really have a dialogue with the public, not with Dr. Cody. Not with the media who just ask bubblegum questions, as far as I'm concerned, but the general public who you serve. And that has been a pet peeve for me for a long time. So I really hope that you guys get around to doing that. It's outside. We could all space around, distance from each other and all that. I don't get that. I don't see the representation. And I don't think Dr. Cody should be getting any awards. There's one in Palo Alto that she's supposed to be getting. We need to do a survey to find out how effective this whole thing was before we give out any awards, don't you think? Thank you.
And that concludes our request to speak.
All right. I think Supervisor Lee, that is a wrap for our meeting today. We have covered all of the items on our agenda. And We have provided a little extra time here at the end of our meeting for folks who wanted it on item number 6. And without objection and hearing none, we are adjourned. And thank you all for hanging in so long. We had a lot to get through and plus quite a bit of public comments. So we'll see you at the next meeting. Take care. Be well.
Recording stopped.